All right, good morning everybody and welcome. We are here this morning for the Department of Health public hearing regarding the proposed rule changes. The specific rules we're discussing today are Rule 7.34.2, .3, and .4 NMAC, otherwise known as the Advisory Board Responsibilities and Duties, Registry Identification Cards, and licensing requirements for producers, production facilities, and distribution. As I begin, I'd like to ask everybody, if you haven't already picked up the frequently asked questions sheet, we have some up there at the front table. A couple of housekeeping notes. The building is under construction on all of the floors of the building, and so we ask you to be very careful if you happen to leave the auditorium to go to the bathroom or if you have business to conduct in other parts of the building. We are streaming this meeting, which is something new for us, and we hope to be able to use this going forward to allow for folks who are not able to attend the hearing in person that they'll be able to watch from their home. If you need to use the facilities, the restroom, please go around to the table at the doors to my right, your left. There is a pass system that we have to use in order to ensure that we monitor and maintain the fire marshal responsibilities for room capacity. We are at that capacity now, so that if you do need to go out, you'll need to have that break pass with you in order to come back in. In 2007, the New Mexico legislature enacted the Linen Air and Compassionate Use Act, which created the New Mexico Department of Health Medical Cannabis Program. The stated purpose of the Compassionate Use Act is to allow the beneficial use of medical cannabis in a regulated system for alleviating symptoms caused by debilitating medical conditions and their medical treatments. A few of the significant proposed changes, and I'm going to emphasize this more than once. These are proposals. This is the process that we go through before those changes or any other rule adjustments are adopted. There are currently 20 medical conditions approved now for qualified patients to gain access to the program. There's an adjustment from a gram or ounce measurement system to a unit measurement system in order to determine adequate supply. And that also incorporates derived products, edible products, and concentrates. You can get a medical waiver to obtain more of the medicine you may need, or a higher level of concentration. There is a registry ID fee proposed for patients and primary caregivers. There is a move from a federal poverty guidelines waiver of fees to a Medicaid enrollment waiver or reduction of fees. There is replacement card fees proposed. There are proposals in the area of testing, packaging. There's proposals in the area of personal production license plant count. There are proposals to increase the number of plants that a licensed nonprofit producer is able to grow. Criminal history background checks have been expanded to cover the additional players in the program and in addition to that, personal production licensees. Licensed nonprofit producers will now be able to have more than one production and more than one distribution facility if they so choose. if licensed nonprofit producers choose to increase the number of plants they grow, there are fees that increase with that. If you're a new license, you're applying for a new license for a nonprofit producer, the application fees have changed there. We have now some guidelines and rules proposed for testing, for manufacturing, and for courier services. Those are just a few of the topics. I want to thank everybody for their written comments that we've already received and remind you that the comment period has been extended. It was going to be this Friday the 20th, but it now has been extended to July 1 of this year. So you have plenty of time to respond even after this meeting. There will be future discussions going on. As I said, this is part of an ongoing process. It's in the proposal stage. We'll take your feedback today, which we're looking forward to getting, as well as additional written comment. We received that from a number of entities and really applaud you for your thoughtful input here. Remember that we're looking for comments specific as much as possible to the proposed rules so that we can use those to help us craft the best possible final product. With that in mind, I want to turn this over to Susan Hafka, the Public Hearing Officer.
Good morning, everyone. Can you hear me? How about that? Can you hear me? How about that? Okay. Thank you. I'd like to welcome everyone here this morning. My name is Susan Hapka, and I am the hearing officer for this hearing. Mr. Groggle is to my left, and he explained to you the rules that we are taking public comment on today. And to my right is Mr. Chris Woodward. He is Assistant General Counsel for the Department of Health. Now, my role in this matter is to listen to all the public comments that come today. The department has also forwarded to me all the public comments that have been submitted. I have them in this big binder, and I have, in fact, read every single one of them. And so I will listen carefully today to the public comments that are made, and I welcome, and the department welcomes additional public comment after this hearing until July 1st. So if you forgot to say something, there's something you want to comment on, you have plenty of time after the hearing to do so. Now, in an effort to ensure that everyone who wishes to be heard today has an opportunity to speak, I'm going to discuss how this hearing is going to be conducted. First, we're going to need to take some breaks during the day, and that will include a lunch break from noon to 1, and we'll be ending the day at 4 o'clock. Now, given the number of people that have come today, my understanding is there's people outside waiting to come in. So we are going to limit comments to 2 minutes today. And I actually have a timer here on my phone, so I'll let you know when you're getting close to 15 seconds. Because this auditorium holds 240 people, and if everyone speaks for 2 minutes, we're almost 6 hours of comments. So I'd appreciate it if you'd honor that time limit. And I think you already know this, but if you leave the auditorium for any reason, please request a card so you can come back in. Otherwise, there are people who would like to take your seat. I'm certain this will happen because it seems that everyone's being very courteous and respectful now, and I request that that continue throughout the hearing. We ask that there be no unruly or disruptive behavior. We also ask that you don't applaud the comments of the various individuals, because not only does that cut into their time, but that cuts into the time that we have to hear other people speak. And we're going to have the public comment at this podium over here. So people are welcome to line up and we'll just take you in the order in which you're in line. If there are any organizations or groups here today, which I believe there are, it would be helpful if you designated someone to speak on your behalf, so we can have more people speak who need to do so. I appreciate your cooperation, and I think we're ready to get the hearing started. Oh, people did sign up. Oh, okay. So this is Andrea Sundberg, and Ms. Sundberg will give you a call then to have you come and speak.
Okay, good morning, everybody. So what we'll do is I'll call you up 3 at a time. If you turn that one off. Let's see if that works. Oh, that's far less annoying. Okay, so we'll call you up 3 at a time. When the last person in that line is coming forward, we'll call up the next 3, okay? So our first 3 speakers will be Vivian Moore, Jamie Hawks, and Steve Jennison.
Let's not knock this over. Does it adjust? Here we go. Good morning. My name is Vivian Moore, and I'm with Mother Earth Herbs in Las Cruces. My husband and my brother-in-law are also patients. If your intent is to kill the New Mexico medical cannabis program, these proposed rules and regulations will do so. These proposed rule changes seem to be more for a recreational program than a medical one. What happened to the compassion? Every single cost is borne by the patients. No insurance company pays for cannabis unless ordered by a court to do so. The patients pay the full price. Millions of dollars and thousands of man-hours have been invested since 2009 by the producers in order to provide safe access to safe medicine in a legal environment. These proposed changes will send nearly every patient currently in the program back to the black market, back to the poison, back to the pharmaceuticals, and back to using cannabis illegally. The Department of Health issued a press release stating that opiate prescriptions are down 10%. They are down because patients are consuming cannabis instead. Doctors are making their patients choose, and the patients are choosing cannabis. One of those patients is a 4-year-old, a patient who, although eligible under the current rules and regulations, was denied a personal production license. This is that 4-year-old. His father wanted to bring him today, but he was unable to do so. He asked that I read the following statement. On May 17, 2013, our lives were changed forever. Jackson, the incredible inspiration that I am proud to call my son, fell victim to a neurological devastation. A brain disease so rare, so relentless, and so misunderstood took a hold of this perfectly normal 4-year-old little boy. It was on this day that my son Jackson suffered his first seizure. For the next few months, we were informed that he would suffer from a condition called intractable epilepsy, an explosive array of misfiring neurons which would send half of his body into uncontrollable convulsions. However, this wasn't just any particular form of intractable epilepsy. Jackson would soon be diagnosed with an extremely rare brain disorder called Rasmussen's encephalitis. Essentially, what was to happen to Jackson was that one half of his brain would steadily be shrinking, being accompanied by progressive and unforgiving seizures and paralyzing one half of his body. Since the discovery of this disease in the early 50s, there have been less than 700 reported cases worldwide. While even to this day there is still an unclear reason as to why or how, there is only one known medical cure for this disease, a radical surgery called a hemispherectomy, a surgery that could not even guarantee seizure freedom. Jackson's anti-seizure medicines were not working. He went into what is called EPC, which left him in a non-stop seizure for 24 hours. Jackson uses tinctures high in CBDs. His recovery has been tremendous. The CBDs are not only blocking any potential seizures from occurring, but they are bringing back the use of his affected arm and leg on the side of his body in which the doctor said he would be paralyzed. Today is seizure-free. Could I please finish? Okay. In addition, as Jackson's licensed caregiver under the current rules, they applied for and were denied a personal production license in order to grow the complete plant for Jackson to use whole plant juicing. To the medical cannabis program administrators, we say, please think about the decisions you are making and think of the patients and parents who are affected by epilepsy and other approved diseases for whom medical marijuana works. Without this program, they would be forced to move to Colorado. Please don't let them move to Colorado. This is Jackson. He's 4 years old. This is a patient on the program.
Hello. I don't break it. I work for MJ Espresso, a licensed producer in southern New Mexico, and I talk to and work with patients every day. I know their illnesses, their issues, their financial troubles, and the proposed rule changes are going to severely devastate patients that are on fixed incomes. These are sick people. They are on disability. The cost is going to be driven up, and that gets pushed onto the patients, which will force them onto the streets to obtain their medicine. It's that, or they don't get it at all. I ask that the department chunk these rule changes, come back, sit down with producers that know patients and know what the patient issues are, and work together to come up with more reasonable things that our patients can still obtain their medicine at an affordable cost.
Okay, our next three speakers after Dr. Jennison will be Joel White, Jessica Halle, and Michael Reynolds. Dr. Jennison?
Thank you. Good morning. My name is Dr. Steve Jennison. I'm a public health physician who lives in Dixon, New Mexico. I was the medical director of the Infectious Diseases Bureau of the New Mexico Department of Health from 1995 to 2010. My office was just down the hall on the other end of the South Atrium. I was a member of Governor Gary Johnson's drug policy task force that originally proposed medical cannabis legislation, and I represented the Department of Health during the legislature's consideration of medical cannabis legislation from 2000 to 2007. When the Linen Compassionate Use Act became law in 2007, I was assigned responsibility for the implementation of the Patient Registry and Medical Advisory Board components of the program. During that time, the Department of Health actively engaged the participation of the Medical Advisory Board in promulgating rules governing the quantity of medical cannabis allowed patients and the number of plants permitted under a personal production license. Input from this panel of 8 New Mexico medical specialists with expertise in medical cannabis issues was not only a good idea, it was and is required by law and by rules governing the medical cannabis program. When I retired from the Department of Health in 2010, I was appointed by the Secretary of Health to the Medical Advisory Board and served as its chair from 2010 to 2013. I remain actively engaged as an advocate on behalf of the thousands of New Mexico patients who I know have received great benefit from this program as was intended under the Linen Compassionate Use Act. This current rulemaking process, as promoted by the Department of Health, is a travesty of the solemn trust that the people of New Mexico have placed in the department to administer this program. The Department of Health not only did not actively engage the Medical Advisory Board in developing rule changes governing adequate supply in the patient registry, they did not even inform the Medical Advisory Board that such changes were being considered. The rule states that the Medical Advisory Board should consider these matters at twice yearly public hearings. Did the Department of Health propose adding consideration of rule changes for adequate supply, personal production, plant limits, and patient registry to the agenda of the Medical Advisory Board twice yearly hearings? They did not. Instead, the Department of Health scoffed at the law and chose to exclude this group of expert clinicians in the consideration of matters that are clearly within their purview. And as if that wasn't sufficiently disrespectful, the department posted an FAQ on their website that unambiguously communicated that the Medical Advisory Board had provided input into the rulemaking process when unambiguously they had not. Thank you.
My name is Joel White. I'm the Vice President of the New Mexico Medical Cannabis Patient Alliance. I've suffered from multiple sclerosis for 25 years. I joined the program in 2010. I'm the face of the typical New Mexico medical cannabis patient. In 2009, I could walk maybe 2 miles, but at that point I would nearly collapse. Last week I went on a 30-mile bike ride. The only medicine I use to manage my MS symptoms is cannabis. Participation in the program has vastly improved my quality of life and the lives of thousands of New Mexican patients dealing with chronic and incurable diseases that are not effectively treated with pharmaceutical drugs. Participation in the program has also been instrumental in supporting my professional success as a productive, tax-paying New Mexican citizen and voter. I am very concerned that the many proposed rule changes will have an extremely detrimental effect on the program, eventually leading to its demise. I also note that no patient groups were contacted or consulted regarding the proposed rule changes, despite the false claim in the DOH FAQ document. I don't believe doctors were consulted either. Patients should be the focus of the Lynn Aaron Compassionate Use Act. I want the program to succeed. However, these changes are very punitive and demeaning toward chronically ill patients. In addition, the rule changes take away a patient's rights to appeal a denial of application, which appears illegal under current law. The New Mexico rules cut the personal production license plant count in half, from 4 to 2. This is the most cost-effective means of producing medicine for our lowest income patients. The rule changes also increase the cost to patients by requiring them to perform an expensive federal criminal background check every year. This cost increase goes from $30 to more than $200 and paints suffering patients as criminals. This is especially egregious for the disabled veterans who make up approximately 40% of our patients, many suffering with PTSD. Why are patients penalized for our diseases? The patients support a regulated plant count increase and safety testing for molds and contaminants. These are major safety and wellness issues we support. However, according to the statements by the only lab certified to conduct this testing in New Mexico, these tests cannot be performed in New Mexico. This goes against the Lynn and Aaron Compassionate Use Act, which was approved by our legislature and signed by our previous governor. As an MS patient with financial means, I can consider leaving the state of New Mexico for a higher quality of life. However, many thousands of New Mexicans cannot have that option. New Mexicans should be treated as citizens with compassion and respect, not penalties, pain, and more suffering. Therefore, I ask to raise the plant count, then invite patient representatives to work with you to modify the rules and strengthen the medical cannabis program.
Good morning. I'm Emily Kaltenbach with the Drug Policy Alliance. I'm here with my colleague Jessica Halai, who is on the list. Drug Policy Alliance has assisted many states across the country with drafting medical marijuana laws and regulations. We were deeply involved in not only the drafting, but the passage and the implementation of the Lynn and Aaron Compassionate Use Act. We're here today to officially register our very serious concern, not only about the rules, but the process itself. While we are supportive of the increased plant count for producers to address the supply crisis, we are very concerned that the rest of the rules dramatically impact patients' access to their medicine. Transparency, accountability, and compassion are all hallmarks of good government. But sadly, none of these principles seem to be present in both the rules that were presented nor the process itself. The department owes patients and their families a very clear explanation of the intent behind each and every one of these rule changes, and they are incredibly expansive. For example, did the department not realize that by restricting the issuance of PPLs to caregivers, they're really prohibiting many parents from providing medicine for their sick children? If this proposed rule change is enacted, it would violate the purpose and the intent of the law. Why did the department increase fees on the backs of sick patients when the department in fact had a revenue surplus in 2013 and had to return that surplus to the general fund? Can the department explain what the increased fees will be used for? Obstructing low-income families from accessing critically important medicine are deeply at odds with the intent of the law and fly in the face of New Mexico values. It's also our understanding that this governor ran on the importance of transparency and accountability. If that's true, why would the department remove their requirement for them to regularly assess and provide reports to the program in meeting the needs of patients? Again, violating the purpose and the intent of the program. So regulatory responsibilities of the executive is critically important, and I value that. But sadly, this is far from that. This does not protect the public's health, or the safety. So we invite you to actually sit down with the patients, their families, and advocates like Drug Policy Alliance to develop rules and regulations that meet the needs of patients. We were never asked. We have a history of supporting the department and this law and the patients, but we were never asked to sit down and actually provide our expertise. I think it's offensive that you're getting input in 2 minutes for a list of long rule changes that will dramatically impact patients. So we ask that you go back to the drawing board, sit down with patients from across the state and listen to them. Listen to how these rules are going to impact their lives. So again, from the point of Drug Policy Alliance, we find that these rules are not only go against the intent of the law, but they go against and really the values of our New Mexicans and do not protect our public's safety or their health. Thank you.
You're welcome to submit additional written
We have, but again, it's the department's responsibility to explain the intent behind every one of those rules. So it's one thing for us to give you comment, but we have never heard why the department are making these changes. And so it's only equally, it's only professional if you provide input back to these patients. Not only are we providing you written comment, you need to provide explanation of why you're changing this program so dramatically. Thank you.
Okay, after Mr. Reynolds, we're going to have Andre Sanchez, Rena, I'm sorry about this last name, Rena, Seisberg, and Louis Shogart. Mr. Reynolds?
My name is Mike Reynolds. I've been a nationally registered paramedic for over 36 years. I've been a New Mexico licensed paramedic for over 24 years. I've worked for the Carlsbad Fire Department for 23 years. The last 13 years of that career I spent as the fire chief for the city of Carlsbad, New Mexico. I'm now retired. I view the proposed changes as a sincere, bona fide effort to tighten up control of the program in order to protect the program, its administrators, the licensed nonprofit producers, patients, and personal producers, and to increase the allowable production volume of licensed nonprofit producers. I'm giving you the benefit of the doubt because however noble and the intent of these changes appear on the surface, the fact that nonprofit producers and personal producers were not included in the process allows loopholes to lurk beneath the surface that will devastate your program. Among the many disastrous changes, the extraordinary increase in license fees for nonprofit producers. Remember, they're nonprofit entities. Eliminating the required assessment of whether the needs of qualified patients are being met. And 3, the narrow definition of adequate supply that requires all medicine come directly from licensed nonprofit producers. These will put the entire program in jeopardy. Your years of hard work and dedication to your patients shall be precipitously undone. Removing the requirement to assess the program implies the intent to have no program to assess. Mr. Len Goodman has listed items from the proposed changes that he refers to as IED booby traps. I refer to them as punji stake pits that shall painfully incapacitate patients, producers, administrators. The Vietnam vets here today understand that analogy very well. Please do not enact these changes without revisiting them side by side with the stakeholders. Thank you.
My name is Andres Sanchez, and I need my medicine. What I don't understand is how you guys came up with 3 times. I mean, is it because there's 3 people at the table, or and Jack and raising the price on non-profit people to 3 times? It's like you should have let them grow this stuff and then charge them 3 times. I mean, these were. Why did it happen this year? What was going on last year? Why wasn't it $25 last year for a registry card and then $50 this year? I mean, it's like you just walked in and slammed everybody in the face. It's like, boom, we run this program and this is the way it's going to be. I mean, I am on a fixed income. I do not have money to just throw around. I don't have a part-time job where I can get extra cash for this pot. And I mean, if the producers, nonprofit, they don't have my cash, have to come up with money to get licensed, if they're gonna send it down to us, we are gonna be taxed. I mean, and why you guys couldn't see years ago that you're gonna need this money? I mean, 3 times the money. I mean, what were you guys on last year? I don't see anybody with a look on their face that they even act like they know what they're talking about. If it would have been 25 last year and 50 this year, it's cool. But you just arbitrarily come in and say 3 times for the non-producers, I mean the non-profit guys, and $50 for the people. I mean, it's like, you could have raised it slower than this. I mean, try that. You know, maybe come back try it at maybe 10 or 15 bucks this year, and then increase it as we go along. And this fact that you're going to hire people is like, you didn't even know you needed people last year? It could have been increased last year, and slowly, instead of this slap in the face like, this is going to happen and you're going to have to come up with the cash. I mean, it's crap. It is crap. You guys are professionals. You should have the brain to say, I see the future, instead of just coming in and saying, arbitrary. You know, that's it. I just can see I need my medicine and I don't have the money for it.
That's okay. My name is Rena Sapansky. I had the privilege of leading the advocates for the passage of the Lynn and Aaron Compassionate Use Act in 2007. I am distressed by the proposed provisions that threaten safe access to medicine, access which was only achieved after a hard-fought battle for nearly a decade. Legislators worked across the aisle and put their compassion for patients first, with one objective: to safely ease the suffering of those in need without compromising public safety. They included a new measure, state license production. But when the legislation was debated, no one even knew if a state license production system was even possible. And if it was, how long it would be to create a safe supply for all patients. What the legislature did know was that no one would have to choose between their life and the law, that patients would be safe from arrest no matter where their medicine came from. I object to many of these provisions. In particular, I object to the redefinition of adequate supply as that only from a licensed source. This measure is unenforceable and only subjects patients, law enforcement, and the department to confusion and possible litigation. It puts patients at risk of arrest. It undermines the heart of the act. Patients have earned their access to their medicine through the legislative process. They have earned their freedom from arrest. Patients like Essie DuBonet and Fred McDonald, who are no longer with us, but who fought for all of the patients in this room. I would ask those of you in this room to raise your hand. If you know a patient who would be harmed by these regulations, raise your hand. What has been proposed here truly violates the spirit of the act. I ask that you delay any new regulations until you have engaged in a collaborative process that keeps compassion for patients first.
Is that okay? Okay, our next 3 speakers after Mr. Shugart are going to be David White, Jessica Gutman, and Bob Boylan. Thank you. Mr. Shugart?
I'm Lou Shugart with MedZin Services. I would like to speak about the role of the advisory board and the importance of their role in the evolving regulation process. They have been included by the statute of the Compassionate Use Act as knowledgeable professionals that can recommend modifications to the regulations. They also can recommend adding or deleting conditions of qualified conditions. Over the last several years, the advisory board has recommended several times that the second signature for a specialist be removed from the patient's applying for severe chronic pain. Against repeated recommendation from the health secretaries to sign this, they have refused to change this. The result has excluded hundreds, maybe even thousands of patients from the program. These patients already know that cannabis helps with their condition, but by excessive costs from 2 doctor visits required, keep them out of the program. It leaves them with the only option available, the black market. It is our responsibility to keep trying to make changes, encourage legal enrollment, and embrace all qualified individuals into the program. Thank you.
Hi, my name is Jessica Gunman. I have severe epilepsy and and I have it's like Tourette's, but it's called aphasia. So excuse me if I stutter or curse. Okay. This administration is notorious for corrupting and for taking money from the people that just don't have it, from the weakest of the population. It's disgusting. I ask you to stop placating to this corrupt administration and do what hard earned. I was the first licensed grower in the state of New Mexico. I was one of the first patients. I worked very hard with my doctor figuring out what CBD would do to my brain to stop the seizures. I ask you to stop the corruption and stop wasting our money with these stupid fucking meetings. Thank you.
Hi, my name is David White, and I would like to present you with signatures of 1,058 people who could not attend today because they are sick, because they have to travel very far. And this is out of the Change.org petition that was started by the New Mexico Medical Cannabis Patients Alliance. So I just want to make sure everybody knows that we are not alone. We are not. There are 1,500 people, 58 people that have signed that are begging you, thank you very much, to go back, get cooperation. Do like the FAQ says, and do please consult with the producers, the patients, and the stakeholders, because we have a lot ventured into this program as well. And everybody in this room wants to make sure that this program continues and continues to help the people that need it most. I will be brief. Thank you very much.
Okay, Lori Berlin, Larry Love, and Eric Briones. Thank you. Thank you, Mr. Berlin.
Hello, everybody. My name is Bob Boylan. I'm a patient. I actually migrated to New Mexico from another state, brought my businesses here as well. It's sad that we have came so far to take so many steps backwards. The lack of transparency is creating a lot of hostility. I think you guys can see that. Hopefully that will be carried over when you look at these rule changes, that if this is about the patients, then you need doctor input. The fact that this came from a legislator or somebody who is employed through the state that has no medical background to make these changes, that's preposterous in and of itself. So the doctors that address you, hopefully you take that very seriously. And on the other side of that, people are very upset. And I've been able to get away from 5 pharmaceutical medicines by using cannabis. I've been free of that for a year. It was destroying my body. I've been physically fit most of my life. I have a degree in kinesiology. I come from a background of sports medicine. This is medicine. This is not a recreational drug. And that needs to be stated to the point that we have to come full circle on this, look at where we've been, and not go backwards. The rest of the country moves forward. This state needs to move forward too.
We've had a slight change. Larry Love has passed on speaking at this time. Instead of him, it will be Dr. Laura Brown. Eric Briones has passed, so Robert Pack will be up after Dr. Brown.
Good morning, everyone. My name is Dr. Laura Brown, and I am a New Mexico physician and citizen, and I'm also a current medical advisory board member of the medical cannabis program. I'm glad to be able to speak at this meeting because I have some very serious concerns about these medical cannabis program proposed rule changes that stem both from the content of the proposed rule changes as well as by the process by which these changes were proposed. These proposed rule changes limit access to medical cannabis. They do not increase the supply of medical cannabis. They also impose financial and/or logistic restrictions for both New Mexico medical cannabis patients and the licensed nonprofit producers. Some of these restrictions have already been mentioned. They include a new 50% decrease in the mature cannabis plants allowed per patient producer, new annual patient registry fees, new monetary fines imposed on licensed nonprofit producers as disciplinary action, removal of patient extensions in cases of qualified patient or caregiver status changes, new required self-paid criminal background checks for both personal producing patients and all persons working with licensed producers, new concentrated cannabis-derived product THC limits, and addition of vague language in several places in the proposed rule changes that add more as yet unspecified eligibility criteria, policies, and procedures which appear to give New Mexico Department of Health the ability to inappropriately further restrict access to medical cannabis. Of further concern to me, the proposed rule changes remove many Department of Health medical cannabis program safeguards which protect the rights of medical cannabis patients and producers. Some examples include, they've already been mentioned, some of them, removal of the biennial medical cannabis program assessment report clause, removal of the New Mexico Department of Health Administrative Review Committee for application denials, licensed producer denials or suspensions, additions of rules permitting producer license suspensions without prior hearing or record review, removal of the deficiency concept that pertains to New Mexico Department of Health violations of the medical cannabis program requirements, removal of the section entitled Denial of an Initial Patient or Primary Caregiver Application, removal of administrative review previously required in cases of denial of initial medical cannabis producer licenses, and finally, removal of rights to administrative review in cases of suspended enrollments of qualified medical cannabis patients or primary caregivers. As a New Mexico physician who has seen how medical cannabis greatly improves lives, I feel compelled to speak out when I see politics like this, like these proposed rule changes appearing to inappropriately infringe on the rights of those who are suffering from qualifying medical conditions, those New Mexico citizens who have benefited from medical cannabis already, and those who could benefit in the future. Secondly, the process by which these proposed rule changes, may I have? Yes. These proposed rule changes occurred without medical advisory board input, which has statutory responsibility for advising the medical cannabis program on issues related to adequate supply of medical cannabis, including personal production licenses and medical cannabis patient registry, in addition to its responsibility of hearing petitions to add new medical qualifying conditions. There is a published current crisis level medical cannabis shortage in New Mexico. I strongly recommend that there is an evidence-based approach to any proposed medical cannabis rule change that involves actual and extensive consultation with the Medical Advisory Board and other stakeholders, especially as it relates to ensuring adequate supply of medical cannabis in New Mexico. Thank you for your attention.
Okay, up after Ms. Boylan, we're going to have Robert Pack, Trevor Reed, and Doug Spiegel. There is a name after Mr. Spiegel that I can't read. So if I skip you, I apologize.
Hi, I am not a patient, but my husband is a patient. The biggest thing that I have a problem with in the proposed rules is the cutting the plant count in half for the personal production license. That will be a hardship on our family because we can't afford to go to a producer every month to pay for the medications that he needs. And I also think that if you're doing it because you're trying to, it says in here that law enforcement concerns regarding the diversion of cannabis, I think all you're going to be doing is punishing the patients who need the medicine. It's not going to deter anybody illegally who is doing it illegally. So that is my main concern. And also I think adequate supply should be determined between the doctor and the patient, not by legislators.
Hi, I'm Trevor. I'm not real good at speaking. I was watching the news this morning, and there was a deal in Iraq where some ISIS folks marched some guys out into a field and dug a ditch and shot them. And I thought to myself, why the heck am I going to Santa Fe when there's people dying across the world? I mean, that's such a big thing. And this is some medical cannabis. But as I was sitting here, I'm thinking to myself, the department's kind of like the guys with the guns. And the patients, we're kind of like the guys getting marched to the field. And I'd like a comprehensive approach to this, which is something we ask of the department. A comprehensive approach to the rule changes. Are rule changes needed? Absolutely. Are these overreaching? Absolutely. Let's go back to the table. Let's act like adults. Let's put the guns down. And let's have a real solution.
My name is Robert Pack. I'm one of the founding members of the Southeast New Mexico Medical Cannabis Alliance down in Carlsbad. I'm patient number 113. Thank everybody for coming. You're all very brave. Southeast New Mexico Medical Cannabis is deeply concerned about the sweeping changes to the New Mexico Medical Cannabis program with these proposed regulation changes. These regulation changes negatively affect all patients. Rural patients will be obviously more impacted due to the cut in the PPL plant counts, an unworkable delivery protocol. There's absolutely no way that this delivery system as presented could work. The new certification and renewal requirements are an extra imposition. And of course, the producers and the changes that the producers are being faced with are going to increase prices for everyone. We all know that. Now, that's not to mention the vast distances that patients in rural New Mexico have to drive. These people have to drive to meet delivery drivers. These people have to drive for medical assistance. So, for example, Southeast New Mexico, the farthest town away from everybody is Jal, New Mexico. Jal, New Mexico is an hour and a half from Carlsbad. That means a person in Jal picking up their medication in Carlsbad has a 3-hour drive. Okay, the deliveries are gone now. We have no more deliveries. Guess what? That patient in Jal now has to drive to Roswell. That makes it 3 hours one way. So the burdens to rural patients are just insurmountable in many ways. The Lynn and Aaron Compassionate Use Act was written to protect patients. This makes the patients the biggest stakeholder in the entire proposed regulations. You folks talk about stakeholders being consulted, stakeholders being spoken with about these regulations. Patients are the biggest stakeholders. Patients were not consulted. The Southeast New Mexico Medical Cannabis Alliance was not consulted. The New Mexico Medical Cannabis Patients Alliance was not consulted. The Southeast New Mexico Cannabis Patients Alliance wants these proposed regulations to be completely rewritten. We would like ongoing input representing rural patient associations and rural patient concerns. We must stress again that we want this input to be ongoing. We don't want a set of questions that's called a survey sent out and being taken as our input. This needs to be ongoing. Thank you very much. Thank all of you for coming. You're very brave people.
Okay, next we'll have Doug Spiegel. After that, Emily Kaltenbach has passed her position to Debbie Armstrong. Nat Dean and Val Heller will be after that. So, Mr. Spiegel.
Good morning. My name is Doug Spiegel. I'm the chairman of the Veritas Foundation. We're one of the 23 licensed nonprofit producers here in New Mexico. I'm also a New Mexico veteran, a pilot in the Air Force, and every day I talk to veterans in my office who say, if you want to shorten lines at the VA hospital, don't take away this program. They're being prescribed the opiates that they're finally trying to get away from. One of the things that is also of a concern is there are thousands of patients in New Mexico that are concerned about these rules and regulations. Just a few days ago, I read a comment from a Department of Health official that said that there are only 250 comments, which is surprising because in my office alone, I collected nearly 200 affidavits, not counting the hundreds of emails. So it seems like there's probably more like 2,500 comments instead of only 250. And these subtle ambiguities in language is a lot of what these 45 pages of rule changes are all about. I just want to comment on one of the changes, and you talk about it here in your nonprofit, your facts. You say nonprofit producers who choose to remain at the current plant count would pay essentially the same fee they pay right now. Well, as a producer, I pay $30,000 a year, and I'm allowed to have 150 plants at my facility. Of that 150 plants, I typically have 75 in flower for harvest for medicine. Under the new rules, I can still pay $30,000 for 150 plants, but I can only have 50 plants in flower. So that means immediately I have a 30% reduction in the amount of flowers that I can harvest for the patients, and I don't see how that connects. So I would ask that you certainly listen to these comments and perhaps involve us next time. Thank you.
Good morning. My name is Debbie Armstrong, and this morning I'm here as a mother, most specifically as the mother of Aaron for the Lynn and Aaron Compassionate Use Act. I don't want to forget the people who worked for decades to create a program that works with compassion for people to access, who are suffering, to access something that works for them. And many people may not know about Lynn Pearson anymore. He was a young man in the 70s that lobbied hard to get a research program for medical marijuana at the university. When funding ran out, it became a defunct law, was revitalized to create this program, and my daughter Erin helped to get it passed, and the Senate kindly renamed the act the Lynn and Aaron Compassionate Use Act. This is about compassion. It's about patients' rights. It's about access to medicine that works for people. And these proposed regulations have done nothing but create barriers to access, making it more difficult for patients, making it impossible for some patients, and it will decrease the supply, not increase the supply. That's been the problem over the last few years, is the lack of supply, not adequate supply, and needing to expand the producer's ability to provide. And instead, you've made it more difficult while pretending to make it expand it. It really will make it more difficult, and you've decreased what an individual or their caregiver can grow, and then created additional barriers by getting background checks, licensing, paying fees. Patients don't have to pay a fee to get a prescription drug. Why would they have to pay a fee to get this? It's absolutely ludicrous, and I'm horrified by what the department is doing to create barriers for access. Where is the compassion? Please go back to the drawing table. Trust the people that you have on your advisory board who you didn't consult. Trust the patients that need it. Trust the producers to give you the input to make this right, to make it work, and to expand its use, create the supply to meet the demand, not the opposite. Thank you.
After Ms. Dean, we'll have Val Howard, sorry about that. David Schneider has passed his position to Senator McSorley, and Colleen Monk.
Good morning. My name is Nat Dean, and I live in Santa Fe. I'm a 30-year survivor of traumatic brain injury, and I have other multiple qualifying conditions. As a patient for the last 4 years, cannabis has helped to mitigate my symptoms. I used to be on 27 medications, and through the program I've been able to reduce it to 6 to 8 and improve the quality of my life.
These proposed rules changes would cause patients to be criminalized and effectively shut down access to many, many patients. If I can't get access to legal medicine from a licensed producer, I'll be unable to obtain effective medicine. Not having access to safe medicine would be the equivalent of walking into the drugstore and facing shelves and shelves of unlabeled medicines, and you just have to hope and pray that you selected the right one for your treatment. There's nothing compassionate about what's being proposed at this juncture, and I implore the Department of Health to actively involve the stakeholders in a legitimate process to collect information about what works and what doesn't for everyone concerned. Let's move forward, not backward, and strengthen, not weaken, and disable the program. We must work together in the spirit of the law we passed here in New Mexico with our state leaders, which we and also you elected. Thank you.
Hello, my name is Valerie Hubbard. I am a patient, I'm an advocate, and I was a part of passing the Lynn and Aaron Compassionate Use Act. Let me get my glasses on and my microphone straightened out. Okay, I want to address a paragraph that's taken from the question and answer sheet page posted on the department's website. This, since all of you have the fact sheet, you can read this. You can read this from your fact sheet. I won't have to reread it to you, but it's going to start with, is it true that the Department of Health developed these regulations without any input from producers and stakeholders? I kind of have to say it's true, but I'm going to take each line. In 2013, the patient survey, I do know patients that received surveys, and other than the supply crisis that was addressed, it is hard to believe that patients asked for these punitive and painful proposed rules and regulations. Input from producers to address the supply crisis in the state, producers did ask for an increased plant count, and producers did ask to increase the number of new licensed producers. Was there other input from the producers that we as patients should know about here? 3, information received from the Medical Cannabis Advisory Board. Medical Cannabis Advisory Board was never consulted about these proposed regulation changes. Professional organizations and advocacy groups. Who are these organizations and advocacy groups? Please post their names on the website so that we may all know who they are. Medical cannabis states. Are these states as large as New Mexico? Are these states as rural as New Mexico? Are these states as poor as New Mexico? Please post these states on the website so that we may know you made a thoughtful and just comparison for us. Last but not least, daily communication with various stakeholders and interested parties. Please let us know who these stakeholders and interested parties are that you had daily communication with. Please list these stakeholders and interested parties on the website. We are the patients, we are the majority stakeholders here, and as the majority stakeholders, we have the right to know, and we have the right to have these questions answered. Consult us. It is essential that we go back to the drawing board. Thank you all for coming out and supporting it now.
Okay, after Senator McSorley, we will have Connie Fornius, Jason Marks, and Jeff McCullough. Thank you. Thank you, Senator.
Thank you, Madam Hearing Officer. This program was supposed to be about the patients. The department is destroying that program. I had prepared remarks today, but what's happened here today, I've thrown out those remarks because I want you, Madam Hearing Officer, to hear what is happening. This is a violation of the Open Meetings Act. You are in violation. The department was told they needed to change this place, and they wouldn't do it. There are people outside who cannot come in because the state police are holding them away.
The Open Meetings Act says that people must be able to observe and attend the meeting. They can't observe, they can't attend. You are in violation of the Open Meetings Act. Please, I don't want to go over my 2 minutes. My constituents, my patients are waiting outside. I was told by the department to come in, and I came in with mixed feelings, and patients gave up their right to come in to let me come and speak. They thought it was important, and only then did I come in. The police are blocking the public's access to this meeting. There was, also I want to say, in my opinion, there was no meaningful input into the writing of these regulations. The department has known for years that there was a problem with the amount of medicine for these patients. I personally went to the department, not the department asked me, but I went to the department as soon as I saw the survey results, and I told them, you need to do something immediately. They said, oh no, but we're rushing to do it. Only months and months later did they publish these regulations, and these regulations, the irony of the whole idea of having a survey that says we are short on product, and what do? They produce regulations that are going to limit the patient's ability to get their own medicine. That's bizarre. It is bizarre. And I think the whole idea that they said they had public input, whatever public input they must have had, they must have totally ignored and thrown in the garbage, because the public input that I know about of people that took the time to go to the department was totally ignored. It was totally turned away. This department wrote these regulations without listening to the public. These regulations, as far as I can tell, were written behind closed doors. They were written by a small group of people who we don't even know, and I want to make sure that people in the audience know, no legislators were involved in the writing of these regulations. The legislature is in favor of patient access. What I find ironic, oh, and by the way, the legislature and the Committee on Human Services, Health and Human Services, has already written a letter asking the department to stop this meeting, that they, as a legislature, have no ability to have any input into this, because the regs were published after we adjourned and before this meeting is being held, before we're having our interim committee meetings, and so there's no ability for us to have any access unless we come here today and come through the police line. This is so ironic that all this is going on when the federal government is saying, and the federal government was the sole reason for having plant count limitations, the sole reason. And now the federal government is saying, we are not concerned about those plant limitations. The idea that this department would have the highest tax in the nation on patients, and I don't know if you know this, but the overwhelming majority of these patients are Medicaid. This medicine is not paid for by health insurance or Medicaid. They must pay for it on their own. And the more fees that you put on this program, the less able these patients are to afford their medicine. Furthermore, the question becomes in my mind, how many millions of dollars will these fees generate, and what is the department going to do with it? Not once in the history of the department did they come to anybody in the legislature and say, we need more money. In fact, the only amendment to the act I sponsored at my request, and the department agreed to it, that all fees collected would go to the program. At that time, we figured we would collect about $300,000, and at that time, 2 years ago, when I passed that legislation, that all the fees would go to this program, we were told by the department that that would be sufficient to run the program. Now, we have millions of dollars in new fees, as best I can tell, and we don't know what they're going to do. They're certainly not, if the fees are going to go the way the writing of these regulations are going to go, it's not going to be for the benefit of the patients. So, Madam, please have some courage. Tell this department that it's out of control and that you will not be a part of allowing these regulations to be put into the regulatory scheme, that we have to stop this process, we have to start over, we have to open the process to the advisory board and to the patients and to the producers and the general public who desperately want this program to succeed, and which program is being crushed by people acting behind closed doors.
Okay, we need Jason Marks, Jeff McCullough, and Peter St. Cyr.
Good morning. I'm Jason Marks, an attorney representing the Cannabis Producers of New Mexico, which is an association of 16 nonprofit producers. Madam Hearing Examiner, before I went into private practice, for 8 years I sat in your seat, and I don't envy you today. I don't know if I would trade places with you from a personal perspective, because you are in the middle of a slow-motion regulatory train wreck right now. Maybe from a policy position, I might want to trade places with you to make sure that this gets done right. Madam Hearing Examiner, in the Lynn and Aaron Act, the legislature said that a patient may be registered upon certification of his or her physician that he or she has a medical condition that qualifies and would benefit from medical cannabis, period. But the department went on and said some conditions require 2 doctors, and some require proof, not merely that cannabis is beneficial, but that other therapies don't work. And then, contrary to law, the department also inserted itself into the doctor-patient relationship, saying it could overrule a patient's certifying physician's own medical judgment. The department now wants patients to pay fees that are not authorized by the Act. The department asserts the power to invade homes and police whether patients are violating the Act's safe harbors. The DOH calls it monitoring. I call it illegal, and so will the courts. The Act says that any natural person or corporation can become a licensed producer, but the department restricts producers to nonprofits. Now it is trying to impose a multitude of new and unnecessary and unjustified restrictions on business practices and strategies that's just going to increase prices. Cannabis should be tested to make sure it's safe and effective for patients, but the department's proposed regs require very expensive routine testing not related to any actual risks. Our group had a survey done that confirms that cost is the primary reason that patients drop out of the program. We brought on an economist from UNM who confirms that the rule changes will significantly increase production costs, which in turn will push patients out of the program either to suffer without relief or go back to the black market. In total, we're turning 180 degrees from our legislature's intention in enacting the Lynn and Aaron Act. Here, benefits that our government, our legislature intended to be taken, are being taken away wholesale. You're hearing today from probably hundreds of New Mexicans about the human cost of the department's rules and why those rules cannot stand. You will read in here, and you don't need to take complete notes, we've got 70 pages about these rules. You'll read why these rules cannot stand legally from an administrative law point of view. But most importantly, as you've heard, Mr. Groggle, are you still here? Madam Hearing Examiner, Department of Health, you said this is a process. Let's make it a process. Let's start over.
Jeff McCullough, patient, veteran, Vice President of Southwest Organic Producers, and President of the only nonprofit personal production club in the state. I would like to address the plant count for the PPL. I don't even know what to say. I thought I had safe access. I thought these people had safe access. Wow, you know. Sorry, I thought we had safe access worked out. Wow. I mean, it just amazes me. I spend a lot of time helping people with MS. They're blind, have a caregiver. They're trying to grow medicine because they can't afford to purchase it from a producer. You're really taking that out from under their feet. Anytime you'd like to come and see what we do and how it impacts a patient, you're invited. We'd love to. I can get the patient we're working with that day to sign a waiver and let you come see what their trials and tribulations are before you go changing the rules. That's all I got to say. Don't change the rules until you know how it impacts the patients. There's a lot of people who have these PPLs who can't afford, like myself, to go spend a lot of money a month, $400 or $500 a month for their medicine. We need the ability for safe access. Please don't take it away. Thank you.
Okay, Mr. St. Cyr, did you want to speak? No, okay. William Ford, Jean LaGrosse, and Laura Mittler? Sorry about that.
William Ford, Executive Director of our Greenleaf Organics. We're one of 3 organizations that claim to be the largest producer in the state. A year ago, I sat with the Secretary of Health, Retta Ward, and described to her the impending supply crisis, as I know a lot of other producers did. She seemed committed, and we saw some action. We saw some movement in the department moving towards helping to solve the supply crisis. They did the right things. They had a survey, they did the research, they developed a plan, they had the important factors that had to be addressed in order to change the supply crisis and provide safe access for more patients. As the executive director of an LMPP, that's my #1 issue, is providing safe access to medicine for patients. The more patients I can reach and help, the better. That's the only charge I have. Unfortunately, what's happened is, and I have to say, Ken, what happened? We all thought that you guys got it and that you knew what needed to be done. The plant increase needed to be put in place. We agreed to increasing the fees if necessary, and more applications for producerships needed to be accepted. I've gone ahead and prepared for the hearing officer and for the program the actual rules as they should have been proposed. These rules here are ready to go, ready to be promulgated. All they do is increase the plant count, increase the fees, and open it up for new applications so that we can produce more medicine for an increasing base of patients. I asked the program and the hearing officer to please do not delay this. We've waited a year. The supply crisis is a crisis at this point. There is not enough medicine and there is no safe access. It's a right. I want to say again, this is a right, not a privilege, a right that these patients have to access safe medical cannabis. Thank you very much.
Okay, Jean LaGrosse, Stephen Tapia, and Doug Gordon. Okay, Jean LaGrosse has declined, so we have Stephen Tapia, Doug Gordon, and Jose Zapata? That's correct.
My name is Stephen Tapia. I'm a PPL, and I'm a patient. I'm not a criminal. Okay, so that's something that I'm here to address, the criminal background checks. Everybody's had something done in the past, okay? Doesn't mean we still are a criminal. I'm an engineer, okay? I grow my own medicine, and what I grow now is barely even enough to provide with what I need. I use topicals, I ingest, I use different things to deal with my pain. I have scoliosis at the back, and as you can see, other problems that I have. I feel like you guys are taking this right away from me. If you guys impose these rules about background checks, everybody's not an angel, but they do strive to do one. Okay. Another thing is, you guys are cutting the personal production license, the personal production down to 2 plants. I can barely even suffice with the 4 I have now in bloom and the seedlings that you are allowing us. I don't have the money to buy from the producers. I was spending $700 a week in buying my medicine from producers, and I can't afford that. I've been in the medical cannabis program for 4.5 years. Before this, I was on a cocktail of Percocet and other pain-killing medicines that didn't allow me to function in life. I wasn't able to hold a job. I've been at my job for over 4.5 years just because of cannabis. Okay? To take this away from me would be devastating. I'm going to still keep growing my cannabis. No matter what you guys say, I'm still going to have my medicine. Because that's the only way I can function in life. It's either that or stay at home on Percocet and other cocktails, which I am not going to do ever again. Thank you.
Hello, my name is Doug Gordon. I'm a PPL holder as well. That man right there, Ken Grogger, showed up to my house 2 weeks ago trying to demand his way into my home. Now, I'm going to read you a few things. I'm requesting a review of my medical cannabis license. Don't you worry, I'll be mailing you your papers. On October 7th of last year, I was violently attacked by 2 men wearing black suits, masks, guns, bats, and large police-style zip ties. After a 2.5-mile run that morning at 9 a.m., I was beaten in my front home. Police would not help me in any manner, even though I had the entire thing on film because I'm involved in this program. Rather, the detective asked me, "Is this a drug deal gone bad?" I had to be taken to a hospital with staples on my head and a splint from my finger due to blocking the bat from hitting my face. Then just months later, you guys hear about the kid that took chocolates to Rio Rancho High? Yeah, well, that was my 15-year-old child that went into my garage refrigerator and stole medical cannabis chocolates. Decided it'd be a good idea to give them out to friends at Rio Rancho High School. If a child steals a beer out of your fridge, they get an MIP, minor in possession. Why is this treated any different? You're teaching my son that when messed up in life, they can punish other people, not him. I never gave it to him, nor did I leave it in a place for him to be accessed. Meanwhile, news reporter Larry Barker, Channel 13, decided to go on my Facebook, pull a picture where I had an accident in a black eye, my hat to the side, trying to make me look as stupid as possible, and then he photoshops a picture of a large grow room that wasn't mine. Then, just weeks after being charged for something I had no control, I decided it'd be in my best interest to have my child move back to his mother's house, which I've had full time since '07. This is a very emotional moment for me. Then I have cops at the end of my block watching my every move, and within days I got the medical director at my house telling me they have a concern. Yeah, either police, news, or Susanna Martinez put my damn name on your desk. I asked for what the concern was, and he stated to verify the number of licenses at my house. I told him he'd need to give me 24 hours notice. He said, not if we have a concern. Actually, you need reasonable suspicion, not just in order to not have the 24 hours. I asked what gave him this suspicion. Ken could not answer me. So I decided not to grant his request immediately, but he tried telling me, Doug, we have the right to do this. I picked up my phone and contacted an attorney. Once the director noticed I seek legal advice, he's like, well, I can tell this is a problem, so I'm just going to go ahead and leave. I came out and said, no, don't leave. His response was, I've waited long enough. Ken then proceeded to drive up and down my street a couple times, waited at the end of the block, thinking I'm doing something wrong. However, I was not. I was only checking my rights. So many traumatizing events have happened in my life. This big guy shows up to my house. Nobody shows up to my house and just tells me what I have to do on a Friday morning. No one. Not you, not no one.
I'm so sorry, Josh. Okay, after Mr. Zapata, we will have, sorry, I lost my place. Vincent Montanista, Dan Rush, and Mandy Denson. Thank you.
Hello, my name is Josh Zapata. I'm a medical cannabis courier and helped design and establish, in conjunction with 12 other producers and the 2 largest medical patient alliance, the statewide delivery system that is still being used today. There's a couple of changes to the rules that I know is not going to make the courier service effective. The 24-hour hold is not enough time to receive pickup packages from all the participating producers, to sort the packages according to route, and the travel times, because we try to bundle as many deliveries as possible to reduce the cost of the route cost. And all these costs, the more, if you want to do a 24-hour hold, you would just increase it and pass it on to the patient. And that really restricts the access to the patient already to 1 to 2 deliveries per month, especially out in the boonies of New Mexico. Also, there have been patients who we have delivered to in their homes, and their homes are within the 300 feet limit. I just want clarification about what would happen if a patient is immobile at his home and we have to deliver and he lives next to a church or a nursing home next to a church. most of these courier changes, you should take into account the distance, the variety of medications that you're going to offer to the patients for that access, the frequency of delivery, the patient mobility, and the cost to furnish that courier service. And we've been doing this for 2.5 years now, and we would love to have you talk to us. Just call us, and we'd love to share our experience and expertise. Thank you.
Good morning, Director Krugel and Ms. Sundberg. My name is Dan Rush. I'm the National Director of the Medical Cannabis and Hemp Division of the United Food and Commercial Workers International Union. Thank you. Would everybody in the room with a yellow shirt please hold your shirt up or make yourself available to be seen? These folks are representative of a phenomenon that's happening here in New Mexico, which is unionizing of the industry. We are the Medical Cannabis and Hemp Industries Union, and I have to tell you, I'm a co-architect, author, and contributor of many of the states that I think you're implying you checked with when you did your proposed regulations, and I got to tell you, I see many mischaracterizations and many misapplications, and also misdefinitions of many of the things that we've done around the country. I have co-authored 6 pieces of legislation in 4 states and worked on regulations in 7 states. We are here to offer our help. Most states reach out to the industry union when they go to develop regulations and have an impact on an industry, especially one of vulnerability that serves a consumer, which is as vulnerable as the patient. You have patients, and you have to look who's here today. Who's here today? Patients, would you raise your hand? Workers, would you raise your hand? These are folks that work in an industry of vulnerability, and you have to get their input. How many of you folks are patients? How many of you folks are industry providers? Physicians? Where did you get your information from? Please, let the union help. We're here to help. I'm not going to stand here and bash you today. As a matter of fact, I'm hoping that you're going to take my business cards and you're going to allow the industry union to help you with your regulations and help serve patients. You have patients in hospice here whose last and final days and the quality of life depends on the regulations that you promulgate. We would love to help you promulgate them. We would love to help you get them passed through your legislative processes, and we would love to help you implement them. So please, reach out to the union. We're reaching out to you. I'm surprised that you haven't reached out to us yet. And please don't leave patients behind. And you have to understand, when you have a regulatory hearing and your building is under siege, and you have to have dozens of police officers to keep the crowd under control, something's wrong. So let's take an opportunity to do it right, and I hope that I've been pragmatic and helpful today, and I look forward to being pragmatic and helpful. Thank you.
Okay, after Ms. Dunson, we will have Moni Carter, I believe. I'm sorry, I have another unreadable name. That's probably it. Thank you. That makes it so much easier when people acknowledge it. And James Norman, thank you.
Hi, my name is Mandy Denson, and my husband and I run Compassionate Distributors, which is one of the nonprofits located in Ruidoso. First off, what I keep hearing over and over again is we need to stop this process and start over after we consult with all of the stakeholders, most notably patient groups, but it would be nice if the producers could be contacted for our input as well. I have submitted written comments, but this is not a meaningful opportunity to develop comments from those who are interested, especially when we hear that there are hundreds of people out there. I just went to the restroom. There are at least 100 people who want to be in here hearing what's going on who aren't in here. We need a plant count increase. I suggest that we start with a plant count increase, have a hearing on that. If we want to talk about fees, talk about it at that time, and then move on to other portions of whatever rule rewrite that the Department of Health wants to do. This is, in general, an overhaul of the program. It's not just adding a few a few different rules and regulations. This is a complete overhaul, and it is unworkable as written, and it will shut the program down if adopted as written. I want to address one small portion in there. There is a rule pertaining to sampling. It's 7.34.4.185. That language would prohibit consumption of cannabis on any premises of any of the nonprofit producers. We have patients that work at compassionate distributors. What that will do is it will prevent the patients from medicating while they are at work. We also actually offer sampling at our Ruidoso location for patients, many of whom drive up 2 to 3 hours away, and they have a driver. We have them sign a book, their driver's signs saying that they are driving, so we have a completely safe way that these patients can at least sample their products before they purchase and have to drive 3 hours back. The reason that is important is because as we know, cannabis works different on every different person, and so it is important for the patients to be able to know which medication works for them before they spend their monthly allotment on the cannabis that they're going to be purchasing, because so many of our patients are rural, they buy their medication in monthly increments. So if they are not allowed to sample and know what it is they're buying, they may purchase something that may not be as effective for them as other strains that we carry. I want to address the FAQ that the DOH put out that says, will fees for nonprofit producers increase? Your response was no. Nonprofit producers who choose to remain at the current plant count would pay essentially the same fee that they pay right now. That is not true. We have the capability right now to flower 120 plants of the 150. We don't always have the 120 in place, but that is how our setup is for compassionate distributors. What that means is we can either modify our setup and knock our production down from 120 down to 50, which is a 58% reduction in the amount of cannabis that we would have flowering at any given time if we want to continue with the $30,000 fee that we currently have to pay. Or we can increase, or we can pay the increased fee, which would then be $70,000 to have our 120 flowering plants that we are set up. Hearing officer, I object to the 2-minute limitation being imposed upon me because that was not part of the official notice. May I continue?
Yes. I'd ask that you wrap up. Because I know you've submitted comments because I haven't documented.
All right, so on my line of thinking, if our fee is increased to $70,000, we would have to, just for the regulatory fee, licensing fee, increase our cost per gram to $1.75 increase. That is anywhere from a 20%, if not higher, increased fee on what we currently charge patients, and that's only for licensing, nothing else. So it is not true that our fee would not be increased. Finally, I would like to see an assessment done by Department of Health. And I would like to know where these rules and regulations came from. There is no transparency, and it's greatly disturbing to me that the Department of Health wants to remove that possibility of transparency by removing the requirement that the departments submit a written assessment, take the temperature of the program for all of us taxpayers and stakeholders to see.
Hello, everybody. My name is Mario Castaneda. I'm a patient with the New Mexico Medical Cannabis Program. I have a PPL. We'll do a little backstory. In 2005, I got hit by a car that crashed to a building on top of me. I was almost killed. A mentor and a really close friend of mine was paralyzed from the neck down. When I was recovering, a friend brought me some pot, and I found out that it really helped. So I started growing it, and sure enough, I got caught. I got in trouble. I got arrested on a Friday. I ended up going to jail, and it was a holiday weekend. I didn't get out for like 5 or 6 days. I wanted to kill myself in jail. When I got out of jail, I couldn't use my pot no more because I was too afraid. all my neighbors were looking at me. They wouldn't let their kids walk with my kids in the street. My doctor, after struggling, I tried to stop smoking pot. I tried to take antidepressants. I took Lexapro. I took Cymbalta. I took Abilify. It just got worse. Finally, my doctor told me that he thought that I should get on the medical cannabis program, and I did. And I crawled out of a really bad depression and a lot of pain I was going through. My kids got to see their dad again. And I run a business in Santa Fe, and I own a home in Santa Fe, and I'm a respected member of the community. I'm not a criminal. I grow 4 plants. I might get 4 ounces that last me 3 months. That's it. If you cut down my plant count, I'm not going to have enough medicine. And I can't afford to buy it. Thank you.
Okay, after Mr. Norman, we'll have Patsy Pell, Brian Webster, and Ben Boreas.
Good morning. My name is James Norman. I'm a disabled Vietnam veteran. I've got 3 Purple Hearts and a Silver Star. I have 5 broken vertebrae in my back, 3 in my neck. I have debilitating pain all the time. I've been exposed to Agent Orange on 3 different occasions. I have PTSD, COPD. Wax or dab is the only medication that works to relieve the pain and the stress caused by this post-traumatic stress. Prescription meds that the VA gave me includes morphine sulfate in 15 milligram tablets. I take one of those tablets, my pain goes away. I have no life. I lay in a bed. I don't move for 12 hours. I take another pill, and for 12 more hours, I'm just a vegetable. No, thank you. With medical marijuana, I have a freedom of life. I can even get up and move. Thank you. Please don't take this away from us. My PPL has increased my electric bill $200 a month. That's expensive. Not as expensive as if I had to buy the product. What we need are not more fees, but the availability of more product. Thank you.
I'm Patsy Pell. My father is Mike Pell. He is a veteran. He's a disabled vet. He suffers from PTSD and chronic pain. Before he enrolled in the cannabis program, he just stayed in bed for 8 years. He wouldn't move. He wouldn't go out. And to see him come to something like this is like, it's like mind-blowing. It's awesome. And these rules and regulations, it's going to take my dad out of the program. He is on a fixed income, and I just don't want to see my dad like that anymore. This program brought my dad back to me, and I don't want to see him taken away again. Thank you.
Hello, my name is Ben Barreras. I'm a patient in the New Mexico Medical Cannabis Program, as well as lead extractor at Herbal Edibles, a third-party manufacturer for gourmet edibles and gourmet infused edibles and salon-quality concentrates for the producers of the cannabis program. I'm here before you today to caution the lawmakers and the advisory board against the 60% limitation of THC concentrates I'm here before you today to caution the lawmakers and the advisory board against a 60% limitation of THC contained within concentrates as noted on page 6, item N of the proposed regulation changes. The passage of these specific changes stands to drastically affect the patient population in ways the DOH may not have foreseen. This 60% limitation will effectively criminalize all solvent-based extractions, including BHO, which completely replaces harmful opiates for treating chronic pain, and RSO, or Phoenix tears, which serves as chemotherapy replacement and also treats grand mal seizures in epilepsy patients. This limitation will also drive patients to the streets to obtain their medicine from unscrupulous criminal sources, or worse yet, they will construct their own makeshift labs to produce their own medicines. And make no mistake, production of these solvent-based extracts is extremely dangerous and should be left in the capable hands of industry professionals. Not only is the medicine dangerous to create without the proper and appropriate safety equipment, not only is this medicine dangerous to create without the appropriate safety equipment, if made improperly, the concentrates can be detrimental to patients if left underpurged. I urge the lawmakers to do the right thing and develop laws that regulate and ensure safe production of solvent-based concentrates for the patients of the program. Prohibition wasn't the answer then, and it definitely is not the answer now. Please uphold the principles of the Low-End Compassionate Use Act and remove the 60% limitation on concentrates from the proposed changes. Thank you for your time.
Okay. Yes.
After Mr. Webster, we'll have Jason Little, Jacob White, and Lynn Goodman.
Hi, my name is Brian Webster. I'm part of the National Cannabis Workers Organizing Team for the United Food Commercial Workers Union. Our union is the Union of Agriculture, Food Processing, and Retail Workers, and the cannabis and medical cannabis industry is a agriculture, food processing, and retail workers industry. So we have been organizing medical cannabis workers since 2010, and we've been organizing workers in 22 plus states that have medical cannabis laws in place. We have been working in states from California to Connecticut on helping government put in rules and regulations, and we advocate from a jobs, revenue, and a worker's perspective. We work in coalition with groups. So we work with employer groups, like we work with patient groups, we work with national law enforcement groups like LEAP, and we have agreements in place here locally with local licensed nonprofit producers such as New Mexican Natural Medicines, Natural RX, and MJ Expresso in the north central New Mexico. As our national campaign manager, Dan Rush, said, we're here to help and we're here to be pragmatic and to make progress the best we can. There seems to be a big problem here that there's no input. There's no input being, received from the employers groups. There's no input being received from the organized patients groups. We have not been contacted and asked for input from organized labor. And basically the room is overflowing and the Capitol is overflowing today with people who have not being heard. So we're here to help. We think that there should be a stop and a start again on this process, because as far as we can see, it's a bad process, and bad regulations are going to come out of it, and that's not going to be a good thing for anybody. And this should be a win-win thing. We should be able to have government, the community, labor, patients, and citizens in New Mexico all working together for their all common good. And like I said, we're here to help and to represent our workers. Thank you.
Hi, my name is Jason Little, and I am the president of New Mexico Alternative Care up in Farmington, which is a rural area up north. There's under 50,000 people there. So these proposals are going to really drastically affect our community. I want to start by saying that the Linear and Compassionate Act has been a godsend for our patients. I talk to them every day. We are changing lives, taking people off pharmaceuticals daily. And I want to say thank you for the program. It's great. The reason we started doing all this talk was to fix the supply problem. All these rules that have been proposed today are not going to fix the supply problem. It's going to drive cost up. In my personal production facility, by $20,000 a year if I keep everything the same. And you're, again, back to the FAQ sheet, you say it's not going to increase fees for the producers, which is far from the truth. The way that we grow, like I said, it will increase by $20,000 annually, which that cost in some way has to get passed on to the patients who are already paying too much for the medicine. Next, the testing. We are one of the few in the state, one of the few that have tested every single batch, every strain, every time, on our own dime, not because we had to, because I wanted safe medicine for the patients. So, the testing requirements you're proposing, we were a big push to require testing because we felt it necessary. But what you're proposing is unobtainable in the state and is only going to drive cost up. Full panel testing through Page Analytical, molds, yeast, bacteria, E. coli, salmonella, all of it. Full spectrum test every time.
Okay. And so is that different than what the current regulations require?
Yes.
And what's the difference?
The difference are there's a high heavy metals particulate matter in the plant that's requiring testing that is unobtainable at this time.
So the other tests have been done but not been verified?
Correct. Not at the level that you're proposing. We can't obtain the levels that are in the laws written now.
So in the sense of the parts, whatever it is, parts per billion or micrograms or whatever the standard is.
Correct.
Can't hear you. I'm sorry, my microphone isn't on because it interferes with that microphone. I apologize.
Oh, okay. So just, you know, the rules were initially open so that we can help supply and get more supply out to the patients. It's taken a year to get where we're at, and we're no closer to getting cheaper supply out to the patients. With all this talk, you guys are even going to postpone it even longer to try to rewrite the rules. Help the supply problem first. We have to have higher plant count. If it comes with a fee to the producers, we're okay with that if we can help the supply. And if it's an adjustable fee, not a crazy fee. You guys didn't ask anything of us up in Farmington, one iota, of what we felt or how these laws should be made to help the patients, especially the rural communities, as was talked about earlier. The unit supply is another confusing thing for people that don't consume or smoke medicine. The unit supply is not going to work because of the oils and the concentrates that they take. Some people with Crohn's disease and these bad problems in their stomach, they can't smoke, maybe because of lung problems. They have to consume more of the oils or the edibles than the unit breakdown that you guys are allocating here. I don't think the unit is the way to do it. Another big problem we have up in Farmington is the pressure that the DOH has put on doctors in the community up there for writing too many recommendations as one doctor. Well, that doctor stops. We have no one writing recommendations up in Farmington. We have 313 registered patients after 3 years of business. That is terrible because the physicians up there feel pressure from the DOH and their medical advisory boards that they can't write these recommendations. It is. They are scared to write recommendations. And so we have people coming. I have 160 patients that have recommendations from doctors in Albuquerque because the doctors in Farmington won't do it. There's another point here. In closing, I just want to say that we open this up to get more supply, cheaper prices. I know Lynn is adamant about getting cheaper prices to the people on the street, or to the patients on the street. We can't do that with all these rules and proposed changes that you have. Everything that's in this is only going to raise prices for everyone. That's all I got.
My name's Jacob White. I've been a producer since 2009, or worked for a producer since 2009, and I'm also a patient. Our program started as a model to states around the country, a compassionate program allowing patients safe access to medicine through state-licensed producers, as well as the ability to grow their own cannabis. As the program has grown, we've faced new challenges that require changes to help the program evolve. The 2013 DOH survey identified a shortage of medicine to patients around the state. Increasing plant counts and adding new producers are great steps towards improving services. What I didn't see in the survey was patients asking to reduce their personal productions or pay a fee for enrolling in the program. Including a $50 fee for enrolling in the program and cutting in half the number of plants a patient can grow do nothing but act against the best interest of patients. This is the patient's program. Please focus only on changes that improve it for them, not fixing parts of it which are not broken. Thank you.
Okay, after Mr. Goodman, we'll have Cher Harrell, James Gellin, and Lyra Barron. Thank you.
Hi, my eyes are weak. Let me try and work back and forth on this. My name is Len Goodman. I'm a patient. I'm also executive director of New Mexican Natural Medicine, who happens to be currently the only nationally certified producer by Americans for Safe Access patient-focused certification. And that includes certification for current good manufacturing practices, compliance with all rules and regulations, and patient care. I'm also a founding director, one of the original founding directors of the National Cannabis Industry Association. I'm a member of the Drug Policy Alliance of New Mexico's Medical Cannabis Strategy Team. I've given expert testimony on behalf of Marijuana Policy Project in legislative committees working on proposed medical cannabis regulations in several New England states. I'm a member of the American Herbal Products Association's Cannabis Committee in the working groups for cultivation and distribution, and developed their current good manufacturing practices and compliance guidelines. I've been a speaker at 3 national cannabis conferences. Those are just some credentials, so I hope it'll lend some credibility to what I want to say. We've turned in a very large document through Jason Marks that I think addresses most of the concerns that we have for patients and producers. I want to address the FAQ sheet. That sheet is inaccurate. I want to address 2. I wrote up comments to it, provided them to the department. They were apparently ignored. I want to address 2 issues on it, some of which have been addressed a little bit already. The first 2 FAQs are simply not true. Quote, the proposed rule change is meant to lead to a reduction of product. Quote, LNPPs, licensed nonprofit producers, would be permitted under the proposed regulations to triple the number of plants that they grow. Second, will fees for all nonprofit producers increase under the proposed regulations? Quote, no, nonprofit producers who choose to remain at the current plant count would pay essentially the same fee as they pay now. Those producers, such as New Mexican, who currently keep 75 plants in flower, would be able to double our production, but it would be at 3 times the cost. If New Mexican were to keep our current production level, our fees would double from what they presently are. And we're talking about going from $30,000 to $90,000 or $30,000 to $60,000. It's not equitable. Excuse me 1 minute, I've lost my place. Those producers, such as Minerva Canna Group, who currently keep approximately 100 plants in flower, would be able to increase production by 50%, but at a 300% increase in cost. If Minerva chooses to keep its current production level, their fees will triple. Those producers, what did you say? That's 2 minutes? I have to say, I object to this. This was not included in the original proposals. There are things that must be said that I have to say, and I'm not a lawyer, as Mandy is, but it seems to me it's a violation of the Public Act. I would like to summarize quickly if I can. I will abide by your decision.
I would ask that you summarize it, and as I've stated previously, anyone, of course, is welcome to submit
Okay, the producers have only 2 primary concerns in trying to carry out our mission to fulfill the mandate under the Limited and Compassionate Use Act. First, to be able to produce enough medicine to supply our patients and to gain efficiency of scale in order to grow and to allow a real market to function and reduce prices to patients. 1/2 of our patients are on disability, limited income, and Medicaid. We were excited to get additional plant production to reduce costs and reach our goals. That's not going to happen under these rules. As producers, we were not given a seat at the table to provide professional input. Most other states with cannabis regulation hire professionals at costs of upward to $100,000 each to provide needed input. The New Mexico producers have that professional knowledge and experience, offered that to the department at no charge. That offer was refused. Why? We demand participation in the rulemaking process. The New Mexico medical cannabis producers are committed to fighting for our patients and their producers, and we will not allow these proposed regulations to be promulgated. We will fight on all fronts using all legal means until the department understands and accepts its obligations under the Luminary and Compassionate Use Act to provide compassionate care for all suffering patients. We will not stand down from our posts until we can truly say, mission accomplished.
My name is Sherry Harrell. My husband is a disabled vet. He has severe PTSD. He's tried the pharmaceutical route, which increased his violent tendencies. And before medical marijuana, attempted suicide. Cannabis is the only medicine that calms his military-induced aggression. He cannot function without this safe, non-side effect medicine. If supplies are limited, both for him personally as growing and the producers, which this proposal will certainly do, more women and families will suffer abusive relationships and loss of marriages and split families. If you were close to any of these war vets, you'd see the relief from pain and mental anguish cannabis provides, and you would be ashamed of proposing the proposals you have made. About the background checks, my husband got into some trouble after Vietnam, spent some time in prison. Are these checks going to be used to prevent anyone who has made mistakes early in their life from having access to this medicine? We do prison ministry through Kairos, and it takes 2 months to get our background checks done. This will increase costs to us personally, the administrative cost for it to be implemented, and I can't believe that if you have possibly thousands of more background checks performed, that will slow the process up even more. Please, please allow the people who need this to get it safely. I don't use it, I hated it away. But I was in fear until that the police would be coming to my house and taking our property until he got on the medical cannabis. Please do not put law-abiding citizens at jeopardy of invasion for doing something that is absolutely necessary for their quality of life and for the quality of life of their families. Thank you.
Good morning. My name is James Gollin. I was a founding board member of the Drug Policy Alliance and worked with Cisco and many others to get this law passed. It took us really, I think, from '98 or so to 2007. Since that time, though, America has changed. Since that time, many other states, now we have, I believe, 23 states or 22 states in the District of Columbia have medical marijuana. We have legal recreational marijuana in 2 states, and by November we may well have it in Alaska and Oregon. We may well have medical in Florida and New York, very populous states. The House has already voted to overwhelmingly and bipartisanly to have the DEA leave medical marijuana in the states where it is legal alone, and the Senate is likely to pass that. So it just feels to me history has changed. We're moving on this issue. We're trying to do it in an orderly and sane way. People have spoken so eloquently about the details of the rules, the needs for the patients, that I won't repeat that, but just to say that it seems like these rules are trying to pull us backwards into the past when we're all very nervous and worried, where I'd love to see New Mexico work with the producers, work with the patients, work with the groups like Drug Policy Alliance that has experience in other states, and figure out a way to move into the future. Thank you.
Okay, after Ms. Barron, we're going to have Tom Murray, Heather Manis, and Gail Lynn Hebert. Thank you.
Yes, hi, my name is Laura Barron, and I'm with Fruit of the Earth Organics, one of the licensed nonprofit producers. I'm also a patient. It was our understanding that these new regulations were supposed to make access increase for the patients and not make the access more limited, more restricted, and more costly. We were excited about the opportunity to bring the cost of the medicine down. That was our prime directive, was to try to make it more affordable. We're in the shop every day, we see people come in, we see how they struggle, not only with debilitating conditions, but with high medical costs that are not covered by insurance. And there's no reason for the cost to be so high if the costs in this state were not so high. And now there's talk of tripling the licensing fee, which will make it impossible for us to do what we hoped, which is to bring the cost down. I've done a look at some of the prices that are paid by other states for renewing their licenses. Arizona, $1,000. Colorado, $3,000 to $14,000, and that's for thousands of plants. California, $8,000. Maine, $15,000. Rhode Island, $5,000. Nevada, $3,000. And now they're proposing in the poorest state in the country to have the highest licensing fee for the lowest plant count in the nation. New Mexico has 22% of its poor population below the poverty line, and that's not even including the people with all of the medical costs. So I'd like to understand, with a department that has a budget last year of $587,000, that's for salaries and non-personnel, while they need to generate fees upward of $2 million. And what will be done with that money? And where is the transparency about how that money will be spent and why it is needed? I'd like to know why the state is going to fill its coffers on the backs of people who are already suffering. I'd also like to say that the decrease in the number of PPLs to 2 is another instance, and the cost of a card at $50 per card. PPLs in other states: Colorado 6, California 6, Maine 6, Rhode Island 12, Nevada 12, Oregon 6. New Mexico, the poorest state in the nation, 2. Why? I don't understand why everything is driving the cost up and the affordability and accessibility more difficult. The regulations should be aimed at increasing access. So I really believe you need to go back to the drawing board.
Okay, Tom Murray, Heather Manis, and Gail Lynn Hebert.
Hello, I'm Tom Murray, the president of Southwest Organic Producers. And after reviewing the recommended changes, after reading the recommendations, I'm totally opposed to the testing. I too are one of the 3 producers who produce, or not who produce as much as Willie Ford, of course, but who test 100%. And the biggest problem I'm seeing is that we're already under USP 2023, which is the highest test in the state now. It's even more restrictive than the testing that you had as your baseline. And The mycotoxin, that's primarily focused at tubers, potatoes, things that grow underground. We're talking about the concentrations of those mycotoxins being at lethal levels, you know, with making oils and things like that. I understand that testing is important, and we take it really at heart to do that. But that testing alone, plus the testing for the heavy metals, is basically going to raise our prices to over $500,000 a year if we go up to the full 450 plant count. And those are real figures. I don't know how this whole process happened, but it must have been in an incredible vacuum because there was no input, or small items were taken and used, and policies built off of them. They weren't put together properly at all. And we need to go back to the table. Absolutely. Thank you.
Hello, I'm Nurse Heather, and I will try to read very quickly. I'm reaching out to you today as a registered and certified cannabis nurse who has seen a dramatic benefit from cannabinoid medicine in the lives and health of my patients in New Mexico and Arizona and other legal states. The proposed rule changes will result in problems for the program and hardship for patients, as you've heard. As it stands, New Mexico has one of the tightest, most well-regulated programs in the country. The New Mexico Medical Cannabis Program has been referenced and modeled after by other states for years. Just recently in Arizona, the New Mexico program was held in high regard as the state who cares about veterans and patients suffering from PTSD. It was noted that New Mexico patients have been receiving legal, safe access to cannabis medicine for several years without any adverse incidents reported or unintended consequences revealed. As a nurse who has personally cared for New Mexico medical cannabis patients, I can firmly and confidently say to you that the program is working and serving patients in a positive manner on a daily basis. There are only a few issues patients bring forth regarding the program as it stands. One, they are faced with medicine shortages or lack of access to needed therapeutic strains available from local producers. Number two, they are located in a rural outlying area where safe legal access is difficult or unattainable. Number three, the heavy costs, including travel in many cases, and difficulties associated with obtaining a written recommendation from a qualifying physician. And number four, the out-of-pocket costs associated with medicine purchases, including delivery costs and non-coverage by insurance companies. Many of these things you've heard already. Many patients who choose to grow their own medicine via the PPL program find the process of growing cannabis as therapeutic as the medicine itself. From a medical perspective, we encourage healthy recreational activities, and gardening is commonly suggested as a therapeutic activity. Most of the patients I have come in contact with are unable to personally produce enough cannabis to sustain their needs year-round. Even those patients who grow for themselves will frequently seek out dispensaries to supplement their continued medicine needs. Growing cannabis is not as easy as it seems. Energy and equipment are costly, and plant cycle completion success rates only increase as patients' growing skills become more advanced. Let me jump to my conclusion. We are asking you to please address the lack of safe access to quality medicine in New Mexico by 1, increasing current nonprofit producer plant count, 2, increase current number of nonprofit producers, and 3, leave the patients alone. Current rules are sufficient as they stand. Number 4, implement a reasonable quality testing protocol. I thank you for your time, attention, and consideration regarding these very important issues. Thank you very much.
After Ms. Hebert, we'll have Monica Altz, Donovan Vestal, and Vicki Gallard. Thank you.
Hi, my name is Galen Aber. Is that better? My name is Galen Aber. I'm a patient. I've been a part of the medical cannabis program since November of last year. I'll be honest with you. When my doctor first approached me about the idea of medicinal marijuana, I actually was very resistant. I did not want to be a part of this. But, I had been managing my symptoms of PTSD and other issues for over 10 years with pharmaceuticals and having mixed results. But I wasn't doing very well. And after countless courses of different medications over many months after he had recommended this, with ranging effects from none to reactions causing me to lose muscle control, to lose verbal capability, to mental ability, and even forcing me to take a medical leave from work, from a job that I'd been at for over 7 years. I felt like I'd tried every pharmaceutical on the market. I felt like I tried everything out there, even at the expense of my own health. I figured, why not? And I went ahead and tried it. What did I have to lose? My anxiety was at an unmanageable level. The pharmaceutical drugs that I were tried, that were working for me were highly sedating or otherwise rendered me useless. I had unbearable nightmares that were chasing me into the day that were just, I couldn't differentiate often between dream and reality. It was absolutely terrifying. But with the help and use of medical cannabis, I'm able to combine strains and to actually sleep peacefully with no side effects, to be able to make it through the day. Medical cannabis has been more effective than conventional pharmaceuticals in managing many of my symptoms and has become an integral part of my treatment. I can no longer imagine a treatment plan that does not include medical cannabis. This is tremendously difficult for me to speak in front of you today. I really hope that my voice will be heard and that the medical cannabis program will not be altered or dismantled. The proposed changes would restrict the number of strains that I would be able to access at any given time, and this would directly interfere with my treatment. The prices would be driven up. The stringent and currently out-of-reach testing restrictions would possibly, they would just drive prices up beyond my means. The fees proposed are high and just one more hurdle to my medication, which I need. So please reconsider the proposed changes and just thank you for your time.
Hi, I'm here in place of Monica Alt. My name is Jessica Halai. I'm with the Drug Policy Alliance, and we advocate, and our efforts are rooted in compassion, health, science, and human rights. And I just wanted to say a few comments about the human cost of delaying this increase in supply that is necessary and needed since the last 3 years, as the patient population has continued to increase and there has been no increase in amount that producers are allowed to grow and no increase in the number of producers around the state that are creating access for patients. For some, it's just an unfortunate problem. For others, it's a devastating and life-changing event if they can't get access to their medicine. I have here with me hundreds of letters and documentation from individuals that I'll submit into record, some of which you've already seen. There's 483 signatures on a petition. Individuals from more than 50 medical cannabis patients provided to us for submission. Some of these patients wanted to remain anonymous because they fear retribution from the program. They didn't want to actually sign their names or even show where their letters were mailed from because they were afraid that they weren't going to have their cards renewed. Which seems like it would be just an unreasonable idea, but obviously this is a fear that has some root in reality. With these proposed changes that have come down, patients see that their needs aren't being considered, and they've become afraid of the program that's supposed to help them. We also have a packet of 133 letters that were gathered from medical cannabis patients from one of the producers in Albuquerque. We just really ask that in defense of patients' access to medical cannabis, please rescind the proposed changes to the regulations of the program, consider what patients need, ask for their input. Patients should not be pawns in a political economy and must have voices recognized and interpreted. We'll also be submitting some helpful guidelines that have been produced by the American Herbal Products Association regarding testing, cultivation, and distribution of medical cannabis. We'd like for you to look at these because the word, at least on the street, is that medical cannabis Department of Health guidelines came from Connecticut. These guidelines have not been implemented in terms of testing, and as you've heard earlier, the testing standards that are looked at have never been tried before. We don't think that they're actually feasible in the real world, and we're very concerned that that alone would crush the program and eliminate access to medicine. Thank you.
Good morning. I'm Donovan Vestal from Red Barn Growers in Gallup. I have prepared statements, but I want to summarize those. Basically, what I came here to ask was, let's take these proposed regulations off the table. Let's come together. Let's get all the parties that are involved. Let's make good legislation. We don't, rules, regs. We do need rules and regulations. We have to have them for legitimacy for our program. We understand that, but let's put together intelligent regulations that take into account all the sides. I said we're from McKinley County. I want to jump off here just for a second. McKinley County is one of the largest and poorest counties in New Mexico. We've got 98 registered patients. We realized way back about 3 years ago that we needed to adopt a different business model to get more medication to the state. We needed to wholesale to other places that had large patient base. If you put in the provisions that restrict us from working together with other LNPPs, we won't be able to do that anymore. We won't be able to produce medicine and take it to Albuquerque or anywhere else that it needs to be. Another issue that I have is education. What's the state doing to help educate the public about the program that we have? I don't see anything. Also, we lose about 1/3 of the program every year through lack of renewals, from what I understand. We should be at about 25,000 registered patients right now, but we stay about the same 10 to 11,000. I feel that that is because it is extremely difficult for our patients who are ill to recertify, to get to their doctor, to do the things they need to do. I would ask that you look at that as well. Thank you.
Okay, after our next speaker, we'll have Carolyn Johnson, Eric Briones, and Larry Love. Thank you.
Hi, I'm Vicki Garland, and I have pages of things I've written to say, but rather, I am so inspired today, I think I'm just going to wing it. I gave my 2 minutes to Len, I'm taking them back. I am amazed and honored at the quality of information, integrity, honesty that the people have here today. I feel that I am in an esteemed company. And I think that the community that we've built here together with producers, making products, being patients, sharing our stories is phenomenal. We have something in common, we have something we share, and we have something we love. When we see these regulations coming in, that I have plummeted emotionally since I've heard these, because I thought, oh my God, we're going to lose our medicine. We're going to lose our health. When I was put on medications, I was reduced to a muddled, confused, depressed, and very constipated person. Those pain meds were the worst. And when I started the cannabis, all of a sudden my quality of life came back. I could function, I could laugh, I had fun, and life, the quality of life came back into my life. And I've seen this countless times, over and over, in all of the stories that you're telling. Aaron, the fact that Aaron's mother is here, it just blows my mind. It blows my mind that we are all here gathered together over something so meaningful to us. It's giving meaning to our lives. So I am going to read a little bit. To the Department of Health, I say, please consider the role that you have at this critical time in New Mexico's cannabis program that supports true health. not masking symptoms that the pharmaceuticals do. The doctors want to give us pharmaceuticals and pharmaceuticals and pharmaceuticals that are not helping us. They do not heal us. Cannabis, I guarantee you, heals us. I have one more thing to say. I watched my husband die in 2002 from liver disease, serious. The only thing that allowed him to eat, preserved any quality of life, and any sense of beauty in harmony was cannabis during his illness. I didn't use cannabis, but I have since had to with my health issues, and it is the only thing, and we all know this, many of us here know this, it's the only thing that really gives us back our quality of life and our health. So thank you.
Good morning. My name is Carolyn Johnson. I am a lifelong resident of Albuquerque. I have had multiple sclerosis for 40 years. I have recently been diagnosed with lupus and Sjogren's disease. During that time, my condition has worsened with little or no relief. I am in constant pain, and it just keeps getting worse. I have been prescribed multiple remedies by many doctors that have usually resulted at best in temporary relief. I am considering medical cannabis as the last resort to relieve my pain. A couple of years ago, I tried medical cannabis as an edible due to a vertigo episode that was caused by multiple sclerosis. It worked very well and removed all my symptoms. However, during my research into the profession, it appears that there are far too producers and suppliers in New Mexico and disturbing shortage of distributors. This creates a constant shortage that not only drives up the price, but may also make certain strains of cannabis unobtainable. Current proposed legislation would impose an unacceptable cost, a threefold increase on annual fees for both commercial and private producers, imposing an annual patient application fee and having potential and current patients pay for their own background checks would create additional unnecessary costs to patients, especially to those on fixed incomes, disability, Social Security, etc., which includes me. All the above would have an adverse effect on the medical cannabis and would most likely increase the price. Keep in mind, patients would ultimately bear the additional cost. Without adequate amount of the producers, suppliers, distributors, resorting to medical cannabis may prove to be difficult and most likely very expensive due to the constant shortages. I recommend that additional producers, suppliers, distributors be approved without additional or newly created costs. Thank you.
Hi, my name is Larry Love. I'm a patient, and I'm a patient advocate, and an advocate for this program. I want to thank everybody for being here today, but you know what? You didn't have to come if these people up here did their jobs right. Okay? The people that run the Department of Health are really not making it work like the Linen, Air, and Compassionate Act is, its intent is supposed to be. This hearing is about rules. Rules are put in place to create order where order is necessary. Many of these new rules are not necessary. These proposed rules cause problems, not solutions. The people at the DOH and the MCP have not complied or carried out the intent of the rules of the Linen, Air, and Compassionate Act. I personally know that Mr. Groggle, the director of the program, does not respect the rules of this program. I know that because he facilitated my removal illegally from one of the licensed nonprofits, and he knew it, and he let it happen. He does not respect these rules. For Mr. Groggles' blatant disregard of the rules and Mr. Groggles' obvious disregard in carrying out the intent of the Lynn and Aaron Compassionate Act, his lack of respect for the welfare of the patients, and the new proposed rules that he is obviously responsible for by being the director, I ask for his resignation or immediate firing.
We've had a request, just so you folks are aware, the next group will be starting at number 128. Not everybody is speaking, so. Parrish Cullings, Penelope Ferran, and Phyllis DeVargas. Thank you.
Hello, my name is Eric Briones. I'm the president and founder of Minerva Canna Group. I'm one of the stakeholders of this industry. But I could stand up here and talk about how these rules are devastating to the producers, but I'm not going to, because this is not about the producers, this is about the patients. And without the patients in this program, we have no program. And every one of these proposed rules and regs affects the patient to the level where they cannot participate in this program any longer. I tried to think, I had a prepared statement like Cisco did, I threw it out because there's so much to say, and I searched for these magical words that's going to make a difference to the people that wrote these rules and regs. But to those people that wrote the rules and regs, I don't think there's anything I can say that would make a difference, because those people are not proponents of this program. If it was the intent to cripple this program, to overregulate it, to overburden it, you succeeded magnificently. If it was your intent to enhance this program, make it easier for patients to enroll in this program and stay in this program, I'm sorry, but you failed miserably. Every line in this new proposal could be argued as to the benefit to this program. There's very, very few lines in this program that enhance this program, in this proposal that enhance this program. Madam Hearing Officer, I ask you right now, right this minute, stop this hearing. Throw these proposed rules and regs out. Make the DOH have stakeholders at a table where we could come back and have a quality set of proposed rules and regs, where we would have a meeting with a different tone that's currently in this room, and that we can have something that will enhance this program and move this program forward and keep it as a model program in the country and in the state medical cannabis states, which this destroys. I ask you, stop this hearing. There's no reason for this to go any farther, because nobody in this room has anything positive to say about these rules and regs. Thank you.
I would just like to clarify my role, because perhaps I wasn't clear at the beginning of the hearing. I'm the hearing officer, and what I do is I listen to what all of your input, both verbal and written, and then I make a written recommendation to the secretary. And the secretary makes the final decision. So I am here to take your input, synthesize it, and make a recommendation. So I don't... I'm okay, let's calm down. Everyone. No, I of course am wanting to hear you, because that's why I'm here. Okay, this is the department is following the rules regarding I'd ask that you put your name down on the list and you're okay, and then you'll have your opportunity to speak. Okay, good. All right, let us get back to hearing from the folks that signed up. Thank you.
Hi, I'm Parrish Collins. I'm an attorney. I have a small law practice in Albuquerque. I want to make a couple of disclaimers. I'm not involved with the medical cannabis program in any business capacity at all. Where my interest lies is I've been volunteering as part of my pro bono volunteer activities as a lawyer for homeless vets for the last year and a half, and that's how I became interested in the changes here and reading the changes. Well, first of all, I'd like to say it's been amply noted this whole process is pretty concerning. It's supposed to be about patients. You haven't heard from patients. You haven't requested input from patients, and that goes doubly so for veterans. And what's really remarkable for me is that in order for a patient to stand up here, and veterans in particular would be reluctant to do this, is you have to give up your medical privacy and speak in a crowd of 240 people in order to have your voice heard. But getting on to the issues regarding veterans, there's no shortage of press lately about how veterans are mistreated. I think thousands of articles, you can pull them up pretty readily. I'd just like to talk about a few of the stats that I pulled in order in preparation for this discussion. 53 deaths per day waiting on VA benefits. 21 deaths in Albuquerque alone regarding the waiting list, whatever that's about. 22 suicides a day of veterans. Do the math on that. 365 days a year. That far exceeds the combat deaths in Afghanistan and Iraq. And so there's a NBC News report, and this is interesting. And everyone here, a lot of people have talked about the cocktail of medicines, and these are dangerous cocktails. These are dangerous medications. And the NBC News article quotes one of the vets, and he says, "My brothers are killing themselves because they're out of options. These VA pharmaceuticals only exacerbate the problem. The listed side effects on these medications are suicidal ideation." So they're being compelled to take medicines that are going to exacerbate the problem that they face. And there are a couple of provisions in particular that brings this problem to the head, and I'll try to get to it as quickly as possible. First of all, the chronic pain, the requirement for 2 doctors to say that you need the medical cannabis for your chronic pain. That forces veterans to go outside their medical care system. VA doctors cannot and will not prescribe medical cannabis. It's against the law. It can be federally prosecuted. So they're having to put their private dollars into private doctors to get 2 recommendations, not 1. That's a problem. Then you look at the fact that it's 3-6 more months for them to get in to see a doctor at the VA, and that gets to the problem of one of the new provisions that says they have to exhaust the traditional medicines. Let me see here. The standard treatments have failed. So they're going to have to run through this cocktail of dangerous medications. They're going to have to do it over a course of years because they can't get in to see their VA doctors, and then only then are they going to be allowed to get the medical cannabis that they need. So this really is going to affect vets pretty adversely. And if you want to hear from vets, you need to come up with a mechanism to hear from them privately. They need their privacy protected, their medical privacy protected, and there needs to be some means for them to have their voice heard. I think vets in particular have earned that right. Thank you.
Okay, Penelope Ferran, is she in the room? Okay. Okay, Rudy Hernandez, Paul, I'm sorry, I can't read the last name, but it's Paul J.C. it looks like. That could be. And William Hunter, thank you.
According to the New Mexico Department of Health, I'll get to this. I am patient number 0132990. I spent 15 years in the Air Force, and my name is Rudy Hernandez. I live in Las Cruces. I currently live here in Albuquerque now. I was a law enforcement officer, and like many other veterans and police officers, I swore to protect the laws of this country. But what I found, and what I'm finding, is that our laws are only written by those people who can get some kind of benefit out of it, mainly the rich, not the poor. As a police officer, I use compassion when making judgment calls, whether to shoot somebody, not first stealing the car, because a car can be replaced. And I would talk people down that had mental conditions. I was trained to talk folks down, and that is a much safer environment than shooting people. I'm also a disabled vet, and I have been waiting to see a medical doctor in the VA for almost 18 months. I do have 100%. I was told through the New Mexico Department of Health that my application, signed by my doctor, for a re-enrollment for my third year in the program, which I had no violations whatsoever. I even had a PPL at one time, but I don't have a green thumb. But I have yet to see a doctor. I just recently moved here from Dallas, Texas, where I became an advocate for cannabis program. And I'm here to tell you that our neighbors in Texas, no matter how much you hate them, they're going to end up legalizing marijuana recreationally there before the medical program. And so is Arizona. But I was told that I had no recourse, that because I turned in my application and I did not have an updated neurological study done, that my study that was done through the VA, I had a neurologist through the VA, actually did the consult. He didn't recommend it, but my physician, I have seen for 3 straight years, who knows about me, she recommended that I stay on the program. But the person that I talked to on the phone, she said 0132990, sorry, you're just going to have to get updated information for our records, and that's the rules. I said, where does this say that? She goes, well, you can get online and you can look it up. I have yet to see any compassion from anybody whatsoever. And I'm tired of being a puppet. I was a Republican because when I was in the Air Force, they told us, and they brainwashed us, that the Republican Party is there to help us. They're there to back up military veterans. Okay, we've got so many people dying, and I've seen people dying. And it's the same thing's happening in Dallas. We've got veterans up there that need medicine. But yet, they're out there shooting them, killing them. Because they have PTSD, they have problems, mental issues. Here in this country, we chose not to deal with mental issues. We want to cover it. That's the problem. Until we stop having puppets like police that are just following laws because they're told to follow them, not because they're right and just, this country will change around. And it's starting. You're starting to see people get upset. They're losing their tempers. But what's happening is that we don't give a crap. All we want to do is the almighty dollar, greed, and that's going to be the same thing for New Mexico. Thank you.
Hello, can you hear me? My name is Paul Culkin. I'm a disabled veteran. I'm 100% disabled. PTSD. I came back from Iraq. I had COPD. I've been in this program since 2009 with Melissa Milam. Used to drive around in a car handing out medical cannabis to people. I cannot freaking believe this kind of crap as far as this frequently asked question thing you send back to us. This is BS. I was a staff sergeant on an EOD team. I was a team leader. I served as the protection of the President of the United States in the Secret Service excuse me, hold on, I wasn't in the Secret Service. I worked with the Secret Service as a team leader. I have a top secret clearance, and these rules for personal production license count cuts and these background checks and all this other crap is bullshit. I'm sorry, but it's bullshit. I was given the authority and the respect when I was in the military. As soon as I got out and I said I wanted to use this medicine, all of a sudden now I'm a criminal. And I'll tell you what, Chris, you're an attorney. You know there's so many damn holes in this program right now. I think the patient should start a class action lawsuit against the Department of Health because this is bullshit. You know it. You know that. Where's the protection? Where's the EPA? They're making medical edibles that don't even have the medicine in it for these patients. I've seen plenty of patients on chemotherapy eating freaking glycerin drops with nothing in it. And these people have taken the authority and delegated responsibility. That's bullshit. I learned in the Army, you cannot delegate responsibility. You only can delegate authority. You need to take responsibility on here for the patients that are being hurt by your program. I'm sorry for getting upset, but that's freaking why I'm in the program. Love you guys. Take care.
Okay, after Mr. Hunter, we'll have Patrick Casey, Lisa Law, and Dwayne Gimble. Thank you.
My name is William Hunter. I too suffer from post-traumatic stress disorder. I've been using medical marijuana since 1994. The gentleman who just left so upset, I feel like that a lot. And I really feel like that about these rule changes. I'm exposing myself here to all these people coming out saying, hey, y'all are treating me rough as it is. I have to go through extra scrutiny simply because of my disorder. I have to have extra scrutiny from the psychiatrists and from the state. And now, because I've got my PPL, y'all want to throw me through more stress with a criminal background check. Okay? I'm not a criminal. I am not a criminal. If you did a background check on me, you would find one thing: possession of paraphernalia. That's it. But you want me to spend my hard money, my hard-earned cash, to go out and take that background check. And I don't think that's fair. I don't know of any cancer patient that has to get a background check for the chemotherapy. I don't know of any gentleman with the prostate problem having to get a background check to make sure he can get his medicine. Why? Why? Can either of you three tell me why you feel it is so important to run me through this stress? Nobody can answer me right now, can you? Well, then whose job is it? I'm just a human being. We're all just human beings. Throughout human history, we've all sought medicine when we needed it. That's a natural thing for us. And now, some of this medicine that naturally produces itself, it grows from a seed, is being extremely scrutinized. And we just came so far. This is one of the toughest states in the nation to get a medical marijuana permit. Why is it going even stricter. That's all I want to say.
Get my notes up here. My name is Patrick Casey, live in Albuquerque. I've been on the program almost since its inception. I think I was patient number 900 or something like that. This isn't the first time I've seen the inside of this room for a similar reason. This is at least the second, maybe the third time. We've had to come up here and oppose rules that have been proposed by Governor Martinez and her officials that she put in place. And we're getting tired of it. She came into office saying that she was going to repeal the program. And we've been living in fear ever since, that she's going to destroy it. And she, step by step, every few months, proposes something that's going to destroy or weaken the program. This is just the latest rule. There's going to be another one down the road, I expect, unless after this election she's gone. And the people she put in place are gone with her. Thank you.
Hello, my name is Dwayne Cabot. I am a Desert Storm disabled vet. I have a very rare neurological condition, spinocerebellar ataxia. It's a genetic condition. There's no cure. I have been through enormous amounts of opiates. That is the VA's answer to everything, is to just give us more opiates, more pills. Since using medical cannabis, I've been able to get off 3 different medications. It is treatment for me, for my pain, for my tremors. It's a multi-pronged approach. And if you raise rates on these producers, it's only going to affect me. Everything trickles down to me, the patient. I can't afford to pay more. Heck, I have a PPL. That PPL is barely enough to provide me the medication I need. I have to go to the producers to supplement. It's expensive. I can't do it. Please, please, please think about the patients. Serve us. We need you. Do your jobs, please. Thank you.
Okay, after Ms. Law, we'll have Patricia Monahan, Kim Householder, and Simon Armijo.
My name is Lisa Law, and I've been living here for 47 years, and I'm an advocate for all these people. So let's start at the beginning. Marijuana has been an herb that's been used by everybody's grandmother here for arthritis and for very different reasons. Before it was made illegal by Nixon and Schlesinger because of Reefer Madness movie that was made. Okay, so now it's illegal. Let's look at the reality of the fact that 400,000 people die a year from smoking cigarettes, 200,000 people die a year from alcohol-related incidents, 20,000 people die a year from heroin and, no, I think it's 10,000, heroin and cocaine use, and nobody dies from smoking marijuana. If you want to smoke marijuana, that's your right. As Cisco McSorley said, if you want to go home and have a drink, that's your business. If you want to go home and smoke a joint, that's your business. There's no reason why it should be illegal in the first place. It's a crime without victims. If we're the only victim from smoking it, that is not a crime. There are hundreds and thousands of people in jail right now for smoking marijuana. You have pushed it with these rules and regulations into the black market, and the black market is what's selling it to the people. What we need to do is legalize marijuana, decriminalize marijuana, legalize hemp, and stop treating these people like they're a bunch of convicts. These people are sick and they need to use the herb that Mother Earth put on this earth. God created marijuana. Mother Earth created marijuana. Why in the world are we made to go through this and all these hoops to feel better if we have a problem? It is not hurting the people. 400,000 a year from smoking cigarettes should be illegal. 200,000 for drinking, but prohibition didn't work. So they reversed it because it did not work because it went into the black market. The same with this. This should not be happening. These people should not be begging the state to use this medicine. It's a medicine. It's going to be legal within the next year, I believe, in this state. Let's be strong. Let's do what Arizona did. Let's be out there helping our people instead of being one of the states that are hurting our people. This is the serious thing I've ever seen in my life, what we're made to go through to smoke the sacred herb.
Hi. A little dry after everybody. I'm just a logistics gal. Kim Householder. I'm owner and CEO of Hotshot Services. We're the largest courier company in the state of New Mexico, along with a couple other that say that also. The 24-hour rule just doesn't work on an economical way. Obviously, in the state of New Mexico, I can get anywhere within 4 hours. I just can't do it cost effectively. Hotshot Services and most other large courier companies, what they call a hub and spoke system. Things are picked up, brought to the hub, and then spoked out to all the rural areas. So if I'm picking up at a dispenser at 3 o'clock today, this afternoon, to come back to my hub, which is Albuquerque, to go out to a spoke towards Jow, there's no way in hell it's going to get there in 24 hours. So that would mean I would have to deliver by 3 o'clock. The only way to economically do this is to use that system so that you put many deliveries with that one. That's the only way to make it affordable for the patients and to have them have access without having to drive to Albuquerque or Roswell, one of the other major cities. I think that you really need to look at that rule just to be able to keep access going. And I think that's about it. Also, everybody loves a free t-shirt, but make sure what you're supporting.
Hello, Madam Hearing Officer and everyone. I'm Tricia Monahan. I'm a patient, and I have been a patient since 2009. In fact, I had to petition to get my condition approved. It wasn't in the original law. I'm also an attorney, and my practice focuses on medical cannabis. In 2009, a friend said, "Do you want to represent a group that wants to be licensed producer? I said, sure. Well, my client was one of the first licensed. So since then, I've been representing many, many, many applicants, and I represent licensed producers in addition. But I'm really here talking today as a patient. I think the key to this whole process is the purpose, the intent, the goal, the objectives of the Lynn & Aaron Compassionate Use Act. And that is to allow the beneficial use of medical cannabis in a regulated system. That's what we need. That needs to be the guiding light for all of these regulations. And number one is, where are we now? Before we know where we need to go, let's see where we are right now. The regulations currently require an assessment report that the Medical Cannabis Department evaluate the implementation of the Lynn & Aaron Compassionate Use Act. That's never been done to my knowledge. Never. The first one was due 2 years after the first regulations went into effect, which was December 08, January 09, and then one every 2 years since then. We haven't had that. And now they're trying to erase that. That should not be eliminated. That needs to be maintained, absolutely, and it needs to be obliged with right now. Do the assessment. Where are we? Are the rules, is the Medical Cannabis Department actually implementing the Lynn & Aaron Compassionate Use Act? And what that means is it helping the patients get the medicine they need. And that is another aspect, the compassion for the patient. That has to drive all of this. The process, as others have talked to, the process is very wrong. Many states have developed task force, and the one and only meeting that I'm aware of that the Medical Cannabis Department, the DOH, talked to the producers was a January 3rd meeting, and only one person from each producer was allowed to be there. I had the honor to go to that, representing one producer. And I asked at that meeting, let's have a task force. Let's form a group of patients mostly, medical providers, producers, lawyers who are working with them and know this, doctors and advocates, and let's sit down at a table and go over all of this. And that would, that's the way this should be done. And you've heard that from many others, but look at other states. That's what they do too, and it works. And I don't want to get it, in fact, people, if you haven't sent in written comments, send them in, or send in even more, because we're all up here saying, oh, these rules suck, they just suck royally. But we need more than that. What's wrong with them? What do we need instead? What do we have to have? So put that in writing. And there's no, I'd love to go over line by line. I've done that for the specifics, but there's no time for that. But there are a few keys that the fees to the patients and fees to producers. No. It's too expensive already. No fees needed to be increased. Plant count. We definitely need plant count, and I think Senator Cisco McSorley may have mentioned earlier, before this was guided by federal guidelines. Oh no, we started at 95 plants because anything over 99, there was 5-year minimum, so we're going to respect the feds who do that. Then the very first and only time these regulations have been revised, in 2010, the plant count was increased to 150 because there was testimony that says that 95 doesn't matter anymore. They aggregate them. Okay. Well, now we have hard written evidence from the federal government that their plant count does not matter. As long as you're complying with regulations in the state, plant counts are relevant. So why limit them to 450 and then charge a fortune that they would just have to pass on to producers, to patients? And the patients, and the other big no-no in this is criminalizing the patients. Time out. We are patients. Why do we have to maintain what we bought in the original container? No. That's putting way too much burden on the patients, and the patients don't deserve that or need that and shouldn't be that. Background checks. Again, expense, hassle, no need. Personal production license, plant count in half. No, that's completely wrong. Can't do that. The application fee for a new producer, you all want new producers? In fact, I think they're the unrepresented group in this whole thing. It's gone from, it was $100. All the licensed producers we have right now, it was $100 application fee. When the rules were revised, December 2010, it was increased to $1,000. But no applications were ever accepted or decided on, so nobody had that. Now it's $10,000 to apply, and they don't step the renewal. The first, if you were approved and were approved for 450 plants, you would have to pay a $90,000 renewal fee your very first time. So first time, right out of the hatch, there's $100,000 cash. No. As we've heard again and again, we're a poor state. That's way too costly, and it doesn't benefit anyone. And in fact, it's contradictory. It's contradictory to supplying medicine to beneficial use of medical cannabis. It's contradictory to that. So I'm really asking, comply with the purpose, the intent, the goals, and the objectives of the Lynn & Aaron Compassionate Use Act. eliminate all the fee increases, and there's many, many, many detailed things for the producers and applicants that you will get in my written comments. But I think it's even going above and beyond what the statute has granted to the agencies, to the Department of Health. And I think that is a big problem that needs to be addressed. But bottom line, the patients matter, getting medicine, and abiding by the Lynn Aaron Compassionate Use Act. Thank you very much.
Hello, my name is Simon Armijo. I just want to know, when we make our medicines and stuff, where are we going to go get it tested? And then I think this is also opening up a fishing expedition for the law enforcement. What they're going to do is when they pull us over and they see we have a medical card, they're going to say, you have any medicine on you? Yeah, they're going to look at it and, whoa, this looks pretty good here. Let's go take it in to have it tested. And then what? And then we're in jail because it's 61% or whatever, 30%, you know? That's not right, man. That's all I have to say.
Did you turn it off? Okay. Well, I would like to take a lunch because I think people need to take a break, get some food in, and I know that I personally get really grumpy when I don't eat. So we'll reconvene at 1 o'clock here. Is that correct? Yeah.
Have been waiting to speak, or we can't need to get back in this afternoon?
Are they still doing the cards at the back door?
No, we'll have a new sign-in this afternoon, but we're going to be going off this list. Hold on. We're still going to call people off of this list. So we're still going to adhere to this list, but for the room capacity, people are going to have to sign back. What if I can't get in before you call my name? I will. Okay. I promise I will.
Good afternoon. We're going to start the hearing again, and I'm glad to see a number of people have made it back. I assume that people will be coming in after lunch. They'll sort of wander in. So that will be fine, and what we're going to do is just start having people give their comments at this time.
Okay, we'll call up the next three people. Simone Armijo, and I'm really sorry on these names, guys. Shannon Cassay, and Doc, it looks like it begins with a G. Okay. Are any of those folks in the room yet? Okay, we'll come back to them. Vincent Constantine, Robert Flores, Thomas Sabo.
Andrea? Yes. If they're not in here yet, will you call their name again? Yes. Okay, good. Thank you.
Hi, my name is Vincent Contrastino, and I'm a patient. I'm also on the board of New Mexico Top Organics, which is a grower, and I'm on the board there because the Department of Health has made it mandatory that they have board members to see what's going on and have patient advocates. I was never notified about any of this goings on about limiting plants for patients and raising prices, or did I ever get a survey? I'm also a patient, and I was on opiates
for conditions that I have, and because of the medical cannabis, I don't have to take those any longer, and my life is much better because of it. So if you guys find a nice ruling in favor for us patients, and make the Department of Health go and ask us for our opinion, especially if we are board members, which they asked us to be. And every year my name gets investigated as a criminal report, so I can be on this board. Besides that, I take a HIPAA exam to be, fully aware of all the HIPAA rights. And I've never been notified about anything that goes on with the cannabis program here. So I think that's something that should be stated to the secretary, that we need to be represented too, myself. I mean, I put my time in my name, and we never get any information about what's going on. And that's it. Thank you very much.
My name is Robert Flores. First, I want to thank our God for putting this wonderful medicine on earth for people like me. I was diagnosed with anaplastic thyroid cancer, very aggressive, rare type of cancer. When it moved to my lungs, I was still with UNM care. They prescribed me Nexivar, it's called. It's a chemotherapy drug. It says it right here on a yellow thing, toxic, dispose of as biohazard. All it's supposed to do is stop. Well, it's not mine, but the diagnosis, it moved to my lungs. It's considered stage 4. Back last August. This was supposed to stop it from spreading anywhere else. All it did was put me in a fetal position on my couch and take strips off the bottom of my feet, probably about 1.5 inches long by 1/4 inch long. I couldn't even walk. I stopped taking this and started taking hemp oil. The tumor in my right lung has completely stopped growing. The one in my left lung is only 25% bigger than when they first found it. Which is, if anybody knows about this cancer, it is very aggressive, and I should have been dead 3 months after they found it. When I switched providers, the first thing my doctor said, since I'm not taking their medicine, he told me, well, the next step for you is hospice. Does this look like hospice? Does it look like I need to be at hospice? No, sir. No, sir. I don't need hospice because of the hemp oil that the Sacred Garden has been providing me, and you guys want to make it more expensive? I have to drive already from Albuquerque to come and get it. Please help us.
Simone Armijo, Shannon Cosay, and Doc C or G. I can't read the full name, sorry.
Hello, my name is Tom Sabo. Hi, my name is Tom Sabo, and I'm just a recent patient. I started taking this at the beginning of the year for my PTSD, and it has had amazing results. I have been on medications since I was 5 years old for a number of psychological issues, and this is the first time I'm able to function without being on multiple medications. And when I saw that these laws coming in, I'm not going to point fingers, I'm not going to blame, I'm just going to say, this is a Trojan horse. What that means is that you went to all the dispensaries, asked them what they wanted. They said we need to be able to produce more, and then someone proceeded to put in a complete overhaul of the entire program into one agreement. That's wrong. That's manipulative. I'm going to just keep this brief. Thank you for this program. It's allowed me to function and be able to stand in front and talk to you guys. So, thank you.
Okay, if we could get Albert Masterson, Dana Rice, and Aron Gatt.
Hi, folks. So here, I'm Ray Masterson. I'm a resident here in Santa Fe. Have been for a long time. I am also a patient myself. I suffer post-traumatic stress syndrome because I disagree with disorder, because I am not disorderly in my life. But what I'm saying is to deprive me of the only thing that treats both my mind, my body, and my spirit is, it's abusive. For you to aggravate my post-traumatic stress disorder with regulations and rule changes and everything that make it harder for me or my doctors to make access to my medication should be criminal. You know, you cannot tease a crazy person in public without paying something. I don't believe you can legally do this to so many patients to purposely aggravate their condition when you don't even check the sex offender list when you issue Viagra. You want me to take another background test where I have done nothing illegal? So what I have to say to the Department of Public Health, which should be as interested in my health and your health as my doctor or your doctor is your personal health, right? Is I will quote Hippocrates, first do no harm. Thank you.
Hi. My name is Dana Rice, and I'm here today as a representative of Sandia Botanicals. We're a nonprofit producer, but I'm also here representing myself as a patient in the medical cannabis program. The changes proposed to the rules and the regs are ill-conceived and will do nothing to alleviate the shortage. I, as a patient, totally reject all of them, just across the board. But I do offer a solution. And I think that I'd like to call on the governor right now to start a task force on medical cannabis. We need everyone at the table. We need the governor to tell her employees to be at the table. All of the stakeholders, all of us are willing to be at the table. But we haven't been invited to the table, nor has the table been prepared for us. New Mexico went through a crisis with AIDS, and we had a big financial problem, and we had lots of gaps in our services. Under Richardson, he called to have a task force on HIV and AIDS. I served on that task force, and we were able to resolve the issues within the budget and within the agencies, and we were able to coordinate things because everyone came to the table. We had an Undersecretary of Health who came to the table. We had everyone there, and we worked it out, and New Mexico became the model for AIDS care in rural states. And we should be able to do that with cannabis. But these regulations do not do that. They do the opposite. So I'm here as a patient, not as a producer, saying I totally reject this. It is totally unacceptable. There is a better way, and the Department of Health has done it a better way in the past. The protocol is already there. It doesn't have to be reinvented. It just needs to be used again. That's it.
Okay, before Mr. God speaks, if we could have Nick, it looks like Nick Za, which that's a great name if that's the name, Timothy Jones, and Stephen Jaramillo.
Hi, I'm a medical marijuana patient for the last 5 years,
And the last 2 years, my prescription has been basically threatened by the Department of Health each year. Last year, it was delayed 2 months when I put in my prescription. Because I am a medical cannabis patient for PTSD, and I'm also a disabled vet, 100% service connected, but I'm not the typical one that's from war. Mine's from psychiatrist abuse. And you people want me to see get a second signature from a psychiatrist every year that I have a permanent condition, and I gave you guys the documents that says it from the VA, that it was my PTSD was developed from a threatening experience from a psychiatrist. And you want me to go see a psychiatrist again every year and flash back. That is wrong. I've done 2 suicide attempts after psychiatrists, and it's documented from the VA. I did it in 04 and 05. I was hospitalized. No, actually it was 05 and 06. And I was hospitalized for it for a week at the VA. And they put me on pharmaceuticals that made me hallucinate that I was dead in that chair. And then the pharmaceutical drug cocktail the VA gave me made me hear my voice saying I was going to die. I took myself off those pills 3 years ago with the help of medical cannabis, and I don't hear that voice no more, or to myself dead in a chair. And you want me to go see a psychiatrist to give me pills again? That's wrong. That's wrong. And a friend of mine who was on those pills 3 years ago wanted to get off them, and he was a nursing assistant, so he understood the whole system. He couldn't, the red tape was so hard for him to get his prescription, he killed himself 3 years ago because he couldn't get off this. And I ran into his mom yesterday. He's 85 years old, and she told me it was the side effects of the pills that killed him. And another thing, you guys want to give us, this is about access, about giving us more freedom to access. I'm a rural veteran. I came all the way from Hillsborough to come up here. I'd have someone carpool me up here. I have shrapnel on my leg, deteriorated disc in my back, paralysis on my right side, and PTSD and anxiety panic attacks. So I couldn't drive up here. I had someone drive me up here to speak for my rights and for everyone else's rights. One of my only support systems of a veteran in my community, Hillsborough, he was a medical cannabis user too for PTSD, a Vietnam vet. Okay, thank you. And he died recently from hepatitis C. He had a hard time getting his access to his prescription while he was in his hospital. We should have access, like right now. Where am I supposed to use my medical cannabis right now? This is a state building. Shouldn't I be able to use it right here? Yeah. I don't have a private residency to go smoke right now. My residence is in Hillsborough, hours away, and I'm having an attack right now. So I should be able to use my state police. I'll smoke right in front of a state police officer because it's a state law. And also, how am I supposed to go to the VA hospital and not have my medicine on me? I'm not allowed to have my medicine on me when I go to the VA hospital, travel hours, and have flashbacks. I can't go to Las Cruces neither because there's a checkpoint there. So I'm very limited to find a doctor. You guys should find me a doctor. Yes. You should find me a doctor. I can't find them.
Hi, my name is Timothy Jones. I'm 25 years old. First of all, it's pretty ridiculous that I drove all the way from Ruidoso last night with no sleep and had to wait outside for 2 hours just to get inside this door. I've had a lot of medical problems since I was 16 years old. I was driven off a 40-foot cliff at 55 miles an hour by another kid whom I was not friends with on a school project. Damaged every disc from my neck to my sacrum. From then, they give me oxycodone, Vicodin, probably 40 other drugs. I couldn't even tell you the whole list. Well, I was allergic to oxycodone. I threw up for 3 months straight every single day because of that drug and because of multiple drugs like it. Then when I was 21, I had a hemangioma, a tumor develop in my right leg. I woke up, my foot was hanging down like this. I couldn't lift my foot. I could not bend my toes. My foot flopped around like a fish. I could not walk for 2 years. I was stuck in a bed for half an hour a day. You have no idea how close I was to pulling a fucking trigger to my head. I'm sorry for the language, but that's how I feel, especially after waiting this long to get up here and then not getting any notice from you guys about how you plan to cut our plans in half. I need those 4 plants. It may not sound like a lot to you guys, but it's a lot for me. What if we have a bug or mildew infection or mold? Every part of our crop is lost, and we have nothing. Absolutely. How can you call yourselves human beings and actually support something like that?
How can you sleep?
How can you sleep like that at night? Honestly, don't you guys have kids that have serious cancer problems and things like that that they needed to be treated? I used to be on over 100 milligrams of methadone a day, 40 milligrams of Valium, 8 milligrams of Tizanidine, 800 milligrams of Seroquel. And I still couldn't sleep. I was up for 11 to 12 days straight before, losing my mind. But you guys really do need to reevaluate the situation and start over. Throw the papers that you have in the trash and rewrite the new paper. Rewrite it.
Yes, hi, my name is Nick Merton, and I suffer from PTSD. I just want to say, I mean, that was an example. I mean, that was a prime example right there of the kind of pain and suffering and loss that people can feel, that people have to live with. Pain of trauma, pain of loss, pain of combat. And there's so few things in the world that can help people with those pain, with pain in general. That I know solvency is important. Believe me, I know revenues are important. I know that staying competitive and things. I know that those are important things to do, but not at the cost. Not at the cost of people's lives. Absolutely. So I hope that I think that if any of you have ever seen somebody in pain, or if you've been in pain yourself and you've hoped, you've wished, beyond hope that you could help them, you could take that pain away from them. This is your chance to do that. This is your chance to take that pain away from those people that you've seen suffering, or maybe you yourself have suffered in the past, and I hope that you haven't. But this is your chance to take that pain away from them in some way and to help them. I'm sorry that you guys have to sit here. I know that there are more important people who should be here, who should listen to this, but it is often a tactic of... It's often a tactic or an often sought thing that people, will put kind of innocent people who often aren't paid enough, who aren't given enough for what they do. They put them in front to listen to these comments, and it's not right. It's not right. You shouldn't have to be the ones that sit here and listen to this. So I just want to say that I empathize with you. I understand revenue. I understand what you guys need. I understand, that you're just here for someone else. But please do everything you can to help the people that you have to go to, help them understand. Thank you.
Thank you. Okay, our next 3 speakers will be Tim Scott, Clarence August, and Karen Byers. Thank you, Mr. Hammond.
Hello, my name's Steve Hadamil, and I'm a PTSD patient now. And I used to be able to speak, fairly well, and what caused this PTSD or aggravated it was my son being murdered by the police in front of our home a year ago in Las Cruces. And I didn't think I'd ever be able to get off Ambien or all the antidepressant or depression medication that they would prescribe me. And the only thing that's helped me the past year has been the cannabis. And I understand what this other guys talking about growing plants, because I don't have a green thumb, and I got my grow permit, and it is hard to maintain plants. So out of 6, I might be lucky if I get 1 good plant to have the medicine I need. I'm also an ex-Air Force veteran. I paid taxes in New Mexico for the last 30 years. I've run a business in New Mexico. I'm educated at NMSU. And it took me almost 6 months just to get the permits that I needed. And I can't believe how hard it was for me, who's educated, how difficult it must be for people that really need this kind of help. So I'm just here to help and represent as many PTSD patients that need this help, and hope that you'll reconsider some of these rules that you guys are going to enact that will make it really difficult for other people to get this kind of help and this medicine that they truly need. So anyway, thanks for listening, and hope they'll do the right thing.
Hello, my name is Clarence August, and I've learned to do many things, but as you can see, shrinking laundry is one of them. I am not a patient. I have a vet. I have no problems to speak of, unlike these people here. I'm here to represent the majority of people who you see an increasing number here across America have decided that the most important thing for us to do is consider their needs and their quality of life to improve. Medical marijuana seems to be doing some effective things for a lot of people here. And I understand that the board are trying to do what they can, but I read through the revisions and it seems like you're doing more harm than you are doing any good. The results speak for themselves. People should be able to be given alternatives to prescription medication if they find it's not working, or in certain cases is detrimental to their health. I also believe that it seems like, from reading these rules, it seems like they're trying to concentrate on more of the recreational use. There is no consideration for the other chemicals in medicinal marijuana, which are helping people, even helping with their cancer. So I would like the board to not only look at these revisions, but also bring to the table a forum for patients, producers, and those who do use, and those who have considered the scientific discoveries for it to basically come to a conclusion, because as talked about with the indispensable opposition by Walter Lippmann, progress and change only comes from both sides coming to the table to improve the quality of life for all people.
My name's Tim Scott. I'm the president of the New Mexico Medical Cannabis Patients Alliance. I'm here to represent the patients in New Mexico. I am a patient. I've been fielding a lot of calls from these patients in regards to these proposed rule changes. The testing protocol, for one, that you've got placed on this is horrendous. You've got too stringent of tests on there for plants, for plant material. It's something that is just unheard of in this day and age. We can't do the tests. The producers can't do the tests that you're proposing to do. It would have to be sent out of state to have these tests fulfilled. That makes it impossible for the producers to be compliant with your new rules. That's just the first issue. Then with the plant count decrease for the patients, patients have a need, and we've established that need. We have the right by the law at this point to be able to use this medicine. It's our choice to use this medicine. With you cutting our plant count, we're not going to be able to have that medicine. To be able to force patients to have a federal background check to be able to grow their medicine, there is no other medicine on the planet that you have to have a federal background check to be able to utilize. We know the effectiveness of this medicine, and it has to be given to us. We have to have the right to use it. We have to have the ability to use the amount that we need for each individual problem. Each person's use is individualized. Each person, the medical marijuana affects them differently. Nobody has the same effects from it. To be able to say that somebody's going to be able to have the best use by having a 60% concentrate rather than the higher concentrates is absurd. I just had surgery. I went the first 48 hours without painkillers because when they gave me painkillers, it made me throw up. Rather than enduring that, I went with cannabis, which stopped my aches and pains from the surgery and helped me get through this. We need to look at the patients and at the needs. These rules, we need to bring the stakeholders in. We need to have the patients' organizations in. We need to have patients involved. We need to have producers involved to be able to put real rules in place that work rather than hurt the patients. Thank you.
Okay, next up we're going to have Gail Carr, Christina Rogers, and Brian Cox.
Hello, I'm Karen Byers, and I've been in New Mexico for the last 2 years, and I am a patient. I'm also kicking off myself and some others in conjunction with the man that just spoke before, the New Mexico Cannabis Patients Alliance. There'll be a Santa Fe-based group, hopefully to pull it together the voice of the northern New Mexico patient voice, as well as, and to work in conjunction with you to help bring that forward. I'm really confused about what I want to talk about this morning because I was one of the patients out front for the first few hours. But I'm going to talk about that at the end. The first things I wanted to come in and talk about were some solution-oriented things that I have been reading about and have also had a chance to experience. I want to, and I will submit this week more information about the American Herbal Products Association's program on certifying dispensing medicine, medical marijuana. I think that's something that really needs to look at instead of coming up with our own rules and regulations. We already have national groups that spent years of focus, have the science to back it, and are bringing it forward, and I would like to see that become the national standard. So again, I would like to help participate in bringing that information forward any way I can. And then, again, my PTSD is just off the chart. Out front was ugly this morning. I was offered to be arrested for being loud. I'm loud. I have been loud for over 20 years on this issue. Can't imagine this going to stop. You've known for a long time that this room was going to reach capacity. We had over 100 patients out front. I mean, it was a beautiful sight, watching them all walk in from the rail yard. I was really excited to have gotten to see that. But when we got here, we were treated really with a block of power. The reason I got offered to be arrested is because I was asking for our rights to access your bathroom and your water. That's all I wanted. And then I was trying to help your staff, saying, you have a very angry situation out here. Is your staff trained to deal with 50 people about to go off with their PTSD? Okay. Anyways, and I was right there with them, so I really wanted that to be addressed. That was a horrible experience, and I've lost my testimony that I so hopefully wanted to share with y'all today, because I'm just a little off, so. There you go.
Hi, my name is Gail Carr. I'm also traumatized by the setup for this meeting with my PTSD and being in pain now and everything else, but I thought it was really important to be here regardless. I'm barely holding it together, so stand with me. But what I wanted to say is I realized how much I take this program for granted. I recently had to leave the state, which meant that I had to go back on narcotics, which was so medieval and awful that I am barely 6 weeks later just trying to get my pain under control again. I had stabilized for several years and could work and do everything that I needed to do. And now I realize how important this medicine really is in my life because I can function and not take narcotics. And in my case, Well, with my family's background, I want to address a few things. Our chemistry happens to be different. In Canada, when my aunt, they change her medicines, they hospitalize her. Here, it's trial and error. Ever since I've been on the medical marijuana program, my accountant who does my taxes cannot believe that my medical bill is 1/10 of what it was for prescription medications. Those medications had side effects that were so bad. I can't even, that's when I say it's medieval. It was like torture. It was making me sicker. One thing I need to say, though, in lieu of all this, with my chemistry being different and everything else, my whole family's like that, is that I now can grow my own plants and make my own medicine. I will not be able to make enough of my medicine because I do not smoke it. I make it in an edible form, which takes more product to refine to what I figured out works for me. And then I can do it and know exactly how I'm dosing myself and when and everything else. I would like to add one more thing. I wish, because this is a green state or a state where we could be green, that we would be allowed to grow all our plants all at once, our 12 plants for the year, and that way we don't have to use electric and everything. I would rather go natural. Thank you.
Hi, I'm Dr. Christina Rogers. I practice Oriental medicine in Albuquerque. I sometimes treat cancer patients, and I volunteer with the Military Stress Relief Project, which treats veterans with Oriental medicine. I'm here today to talk to you about the fees that you charge for people to access their medication. It was $30, now you're taking it to $50, and I see this as a tax on sick people, and that's just wrong. I'd also like to address the plant count for personal growers. As a notorious serial killer of houseplants, this is not okay. My cancer patients, sometimes the matter of getting a little puff of medication makes all the difference as to whether or not they get to have lunch with their grandchildren or go to the hospital.
Okay, after Mr. Cox, we will have Susan Johnson, Valerie Romero, and Jill Smoller. Thank you.
My name is Brian Cox. I've been on this program for about 3 years now. And that was after the fact that I went in to see some doctors because I was having issues with anger. And I've had a huge anger problem. You piss me off, and trust me, you'll know it. Well, right now, I'm going to address the psychology people. And I know you're a psychologist, or were, or something to do with psychology. You. Were you? Who was? Somebody was in psychology. You two are attorneys. Well, you know, there's a real problem here. Because, number one, I could go through a whole bunch of stuff. A lot of these people have already talked about it. It's already been addressed and issued. The drugs, the cost of the medication, the amount of control that you guys are trying to issue on everybody here. The Medical Cannabis Program was created under the Lynn and Aaron Compassionate Use Act. The purpose of this act is to allow the beneficial use of medical cannabis in a regulated system for alleviating symptoms caused by debilitating medical conditions and their medical treatments. We all have to sign something when we get into the program. Do you guys ever read any of this stuff? I doubt it. Let me read something else to you here. I had it marked, but I just... You ever read the Bible? You ever opened the Bible? Have you ever read the first page in the Bible? Genesis, in the first book. 1:11. Then God said, let the earth bring forth grass, the herb that yields seed, and the fruit tree that yields fruit according to its kind, whose seed is in it itself on the earth. And it was so. You know what? That plant that you guys are regulating and trying to control us, that was put on by God. That was put on this planet by God. You have no rights to sit there and violate our rights, God-given rights. And that's exactly what you're doing. And you want to get into rights? You know what? This lady right here knows I almost didn't make it through last year. You know what I had to deal with? And I bet half of these people understand. It's called autoimmune. There is no cure for it. In fact, there's so many doctors that have such a problem diagnosing it, they can't diagnose it. They tell you to go see a psychiatrist. And they get on psycho drugs because it's in your head. The hell it is. I got the medical records. Can you tell me, anybody in here tell me how TSH on your thyroid can go from 0.081 to over 100, maxing it out on the charts? Not even a damn endocrinologist in the state can do it. How about Hashimoto's? A doctor of Oriental medicine that I had been seeing because I gave up on this medical program in this state with the medical doctors here is a joke. My mom passed away with thyroid cancer. She had thyroid cancer. She had her thyroid removed 2 times. One at 2 years old. That was before they even heard of thyroid problems. You guys need to get educated on medical problems before you start regulating any kind of medicine on us. You're violating our rights. I spent 3 years fighting the cops down in Belen and a state cop. I'm getting ready to sue the hell out of everybody. You think I'm joking? No, I'm not. You know what happened in that time? I had one of those damn cops down there. I was having an anxiety attack. Or whatever this Hashimoto's attack thing is, this autoimmune attack, whatever's attacking my body. I could sit there and show you a bunch of stuff. But by God, you know what? That cop sat there and told me I had nothing wrong. Medically. It's in the documents. It's in the court papers. You want to see them? 4 days prior to that, I had a federal judge grant me full disability because of my medical. You need to educate your damn cops around here, too.
I just want to thank everybody for their comments today. I don't really want to get too much into who I am just yet. I just want you to know that I'm a byproduct of a World War II veteran. And it's yet to be determined who I am because I'm constantly recreating and redefining myself. I should be getting 100% disability because my symptoms justify it. I defy all these stigmas. I'm here today because by the grace of God, I know there is no mocking God's creation. I'm the other side of the coin. I am that convict you guys are trying to keep out of your schools. I'm that convict you guys are saying do a background check on because I'm not credible. I'm not qualified. I'm not credentialized. I stand here today 8 months away from a bachelor's of social work degree. I had a 6th grade education. I went through... well, first I want to say thank you because I understand you're here to advocate and represent the population. I'm the client. Represent the community and the population. I have a proposal right now to expand through the Southwest Disabilities further research for PTSD, which would include an expansion on medical cannabis because, as we see, our audience here today justifies the need for such measures. We do need to start cultural competency the way, I need accommodations and I don't feel comfortable addressing these things on the telephone. I do understand I need to get these things set a couple of weeks in advance. I didn't know I'd be here today. I came here today overcoming all kinds of anxieties and things that I have every reason not to be here. I may lose my job. I lost my clearance from the Department of Health after I found a discrepancy in a Texas record from when I was 17 years old. I've been a convicted felon since because of a mistake in my background. I went to prison at 18 years old because of this mistake. I cleared my record in 2007. This is the longest I've ever done. And it's because of the faith of the institutions. I'm rebuilding my faith in the institutions because of people like yourselves that are advocating, representing the people and the citizens. We need training on cultural competency. We need to start embracing people with PTSD in our institutions. And I'll be damned if they're going to keep me out of your public schools and your public institutions. And I don't think I'm the one that you need to keep out of these places. I'm the one that's there to protect. And I'll tell you, I'm here to stand up for Chicano rights, the movements, and I'm standing up for my civil rights, and there's going to be a movement. So I just thank you, and I appreciate your time today.
Hi, my name is Jill. I am patient number 85. The first time I used medical cannabis, the first time I used marijuana, I was 29 years old. I have secondary progressive multiple sclerosis. I wasn't diagnosed. I've had it since I'm 19, but I was diagnosed at 26 after the birth of my first daughter, my first child. I had a son when I was 27, and it sent my MS into a tailspin and put me in an electric wheelchair. I debilitated very, very quickly, very rapidly. Very soon I was on 27 different medications. I was unable to care for either of my children. And I participated in a trial that included chemotherapy treatment with a combination with an injectable that caused an infection, a low-lying infection in my body, and was under the care of infectious disease for well over a year. I almost died from one of the drug interactions from the many pills I was taking. And after that, the prescription medications made me a zombie, and they weren't helping. I had zero quality of life. I wanted to die. And as a last resort, my neurologist suggested cannabis. I was scared. I'd never tried it. I'm a resident of the state. As a kid, I went to statewide dare contests in school. I'm a law-abiding citizen. I believed what my government told me. As a last resort, I tried it. Cannabis to me is a medicine. It always has been. I am standing on my feet today because the last time that I used an electric wheelchair was August 4th, 2012. Once I tried cannabis for the first time, I have not gone a day without it. I saw such remarkable results within minutes that I got myself off every single pharmaceutical medication that I was on. And I was able to rehabilitate myself to this point. I'm also able to rehabilitate myself. I just incorporated a business in this state, a fully 100% woman-owned business. I have a purpose, I have a life, I have a quality of life. The message I want to send to you, what you are doing, we have a respectable program in this state, and I've always been proud of that because it legitimizes what we are doing here, legitimizes the research and paves the way for medical research to find out about my disease and about this plant and why it's helping people like me, because I'm not the only one. Beyond that, it's a family issue. CYFD has been to my house 3 times separately because of the medical marijuana issue in my home and no other accusation. I was just cleared on June 5th for the 3rd time. All charges have been unfounded. They go to my children's school, they talk to their teachers, they talk to my friends. My children live in fear. They are now almost 11 and 12. This morning, they helped me color the signs, and this morning they were crying in fear that mommy would lose her medicine and I'd go back in a wheelchair, because now I can go on bike rides with them and take them to the pool, and I can actually participate in life. I will leave you with this one last thought. I don't think that any of you would be sitting up there if you truly understood what any of us have gone through. And I hope that you never have to. I hope that you never have to go through that. But beyond that, I hope sincerely that each and every one of you never have to watch somebody you love go through something that we're going through and live in fear. I am tired of living in fear, and so are my children. This has to stop. Thank you very much for your time.
Okay, can we have Mark Smoller, Bill Loomis, and Eugene Hartshorn? Thank you.
Hi. Good afternoon. My name is Susan Johnson, and when it was first advertised that the state of New Mexico was going to get into the medical marijuana program, I was very proud of the state for bringing the medical cannabis program into the state. It appeared so much that the state leaders and the Department of Health personnel were determined to bring this vital medical program to its residents in a controlled and creditable environment. The eyes of many other states were watching New Mexico in those days. Now, however, the compassion in the Compassionate Act is gone. Caregivers are restricted in their ability to care for a large enough group of homebound to make it worth the efforts. Producers are unilaterally subjected to higher costs and regulation restrictions that cannot be met. Patients are hit with ever more costly and unnecessary licensing renewals and growing restrictions. Doctor appointments alone can cost up to $350, and you want them to pay this annually. At this time, health additions do not include any respiratory issues. That's me. I have 18% lung capacity left. 3 doctors in Colorado and California have both told me that if the medical cannabis program would help, I can't get on it. I would like to experience what these people are seeing. The ability to go through the day without having to deal with the effects of prednisone, without having to worry about my heart rate at 170, without having to worry about whether or not I'm going to be able to make it home. I can still function in the work environment at this time. I hope to do so next month. Please take care of the needs to get the cannabis out to the individuals who need it. Increase what they need, increase the licenses, increase what the producers can produce. Leave the current patients alone. Help them to get better access, not better restrictions.
My name is Mark Smoller. I'm not a medical patient of the program, but I'm here in full support of the medical cannabis program in the state of New Mexico. My spouse has benefited greatly from medical cannabis that allows her to have a functional life that no other injectable medicine, chemotherapy, or prescription could ever do for her. I remember a time after our kids were born where Jill was bedridden and needed help just to care for our 2 wonderful kids as well as herself. Her doctors prescribed every medicine and prescription in the book, including concentrated chemotherapy, just to slow down the rapid progression of her debilitating disease. Because of medical cannabis, she was able to eliminate all the dangerous prescriptions that almost killed her. And because of cannabis, she now can actually have a good quality of life, and our kids benefit from having a mom who loves them dearly and can actually have a productive and functional life. The proposed regulation changes would hurt my spouse and the amounts that she needs to produce in order to keep her aggressive disease at bay, and it would only make her life a struggle once again. I'm here on behalf of my spouse and all the other patients in the program who can't make their voices heard, and I'm asking the Department of Health to do away with additional restrictions and barriers into the program and go back to the table and revise things to benefit patients and ease of access instead of making things harder for the patients who need it the most in order to have some kind of quality of life. I'm also asking the department to open up the program to additional digestive disorders that could benefit from medical cannabis and other autoimmune disorders. And I want to thank all the vets who've come down here today in this room for fighting for our freedom and our speech. Thank you, guys.
I'm also not a patient. I'm also here to tell you a story about my spouse, how life can change. My wife worked for the Council of Governments and the WIA as her fiscal advisor, and she was doing very well. Also, she was going to college at night and getting her degree, and she ended up with a misdiagnosed appendix attack in our hospital there in Tier C. And when the doctor misdiagnosed it, he sent her home with painkillers and things to lower her blood pressure, but did not take a blood test even. Okay, by Monday, she was in serious condition and ended up having to go in an ambulance to Las Cruces, to the new medical facility down there. When she got there, the doctor says, I'll have that appendix out of there probably in 45 minutes. Well, she had been, the peritonitis had taken over her system, and 9.5 hours later, she finally came out of surgery. The doctor also said that things weren't over for her, that she would have a lot of complications because of the peritonitis. He said there will be cysts and tumors and things arrive. Okay, so finally, because of what happened, she had 7 operations for adhesions, cysts, tumors, those kind of things. During that process, it was decided by another doctor in Tier C to put her on pain management, okay? Oxycodone, Oxycontin, fentanyl, okay, in unbelievable proportions. Finally, it got her to a point where she couldn't function. She had to quit her job. She gained almost 200 pounds. She ended up with lymphedema in her left leg. She had shingles for 2.5 years. All of this Oxycontin, Oxycodone, all this stuff was breaking her system down. Her kidneys were failing. Her liver was failing. This lady was sick, let me tell you. She ended up on her hands and knees one night in our home. I came home and she was on her hands and knees and she said, I want to die. She had a Charlie horse in the back of her neck. It was like a bowling ball. You could have beaten on it and it was hard, like a bowling ball. I called her doctor and said, I need to meet you right away in Las Cruces. He said, well, I don't have time. Something, I'm going to make my rounds. And I said, okay. So I hung up the phone. I called UNM Hospital. Luckily, I had a friend that was on the Regents of UNM, and he met us there and got her admitted. She ended up on a program of methadone to get her down off these opiates. They were so strong. We were going through $600 every 4 days above and beyond what the good state insurance would pay, both of us working for the state. And still the doctor was prescribing, the pain doctor prescribing more. That was just giving it like candy. Anyway, she ended up, it took her 3 years to get off of that, to bring her down off the methadone to where she could function normally. She had the finest spinal surgeon and neck surgeon. She ended up with 3 cracked vertebrae in her neck from that experience with the Charlie horse. Why does cannabis be treated as a Schedule I drug, like cocaine and heroin, and oxycodone and Oxycontin aren't even scheduled? Where does this picture figure out? It's not even fair. She finally gave back to the Sweet Foundation. She founded her own foundation after she kicked all of this. Believe it or not, she did it by herself. She started her own foundation called the Sweet Foundation that helps people because she has been in such dark places and nobody can imagine how dark it can get. And I experienced that following her around trying to pick up the pieces. She now works for MJ Express, which is a patient advocate place in Elephant Butte, Tier C area. And she, by the way, that organization also helps the seniors in Sierra County with a senior meal site. So there is a byproduct function of MJ Express. She got permission, even though she's disabled, to work there for 3 days a week. I guess I have to say the pharmaceuticals are euthanizing people, and the marijuana is allowing them to live. I believe you all ought to consider a background check for anyone that drinks alcohol or takes opiates if you're going to force private individuals.
Thank you. Okay, we need Amanda Salinas, Jeremy, last name begins with an A. I'm sorry, I can't read that. As a Jeremy, okay. And Pascual Maestas. Thank you.
Hi, my name is Eugene Hartshorn. I was on some really heavy narcotics. 2 years ago, I joined the group. I started medical marijuana. I'm not a very good speaker, but...
Oh, that's fine.
And I've been off all the heavy drugs. I haven't done anything. The only thing I do now is a little bit of tramadol with my medical marijuana. And I feel better. I'm able to do things where when you're on the heavy drugs, all you can do is lay around and sleep and hardly do anything. And that was Oxycontin and Demerol. So, and I live on $700 a month. My house payment's $465, and let the rest of my bills take up the rest. And if this is getting any higher, I'll be out, unable. I thank you.
Good afternoon. My name is Armando Salinas. And that's with an O, not an A. $2.60, $35 for 4 years, $50 for 1 year, $2.60 to kill yourself with oxycodone, $32 for your driver's license, $50 for something that can help me complete my day, allow me to go with my grandkids and have a functional day, and you want to charge me, and that's for 1 year? I think that's ridiculous. We have so many people that are on this program that are permanently disabled. I'm one of them. And yet I have to renew every year. Every year. Now you want to tell me, oh, no, sir. Besides you having your little check with other people that are on set incomes, I'm one of them too. Like this gentleman said just before me. By the time we finish paying all our bills, we're lucky if we have $20 to put gas in. And then you want us to say, oh, but you want to smoke your medical marijuana or you want to eat your edibles, you're going to have to pay $50. Okay, well, let me tell you something else that I really found out about by Google, like I told you earlier. You say you're just a representative. Okay, we have the right of freedom of speech and assembly with our court, with our appointed officials. If you're not the secretary, then why are you here? Bring us the secretary so he can talk to us, and not you. So that way we don't sit here making you feel bad, make you want to cry, or make you want to yell at the top of your lungs. Yeah, you're right, you're not in charge of it. You're right. Well, then send somebody who else is in charge of it so that way we can talk to them and direct it to them. Last year was Ben Ray Lujan. Now it's this other guy this year. Who's it going to be next year? This year it's $50. Next year, what is it going to be? 100 or 75? Come on. What I said about my license, I really mean that. If you're going to charge me $50, I'll tell you what. I'll give you my license right now, tear it up, and tell you, keep it. I can get better weed and cheaper cannabis on the black market. Because of your guys' rules and regulations, you're making all these other dispensaries compete with one another. Instead of competing with the dispensaries, they should be helping each other. You know that over there in Portland, Oregon, California, and even our neighbors right above us, Colorado, they have this thing called a care package. If you don't have the money, you can go and get from a dispensary a little bit of something that can help you out and to manage your pain. But because you guys because you guys take it too long. You guys make it so difficult. Our dispensaries can't offer that out to people that need it. Come on, work with us, and we'll work with you. Otherwise, you know what, we're just going to say, the heck with the medical cannabis program, and let's just go back to the black market. Who benefits there? It sure in the heck ain't our state. Let's make it to where we can all be happy and our states benefit, our kids benefit, and you know what, and we'll be happy. Stop all the regulations. Take a step back and redefine what you're trying to do. Because all you're doing is making it harder for everybody else in question. I'm not here for myself. I'm already on the program. Thank you. But you know what? What about the other people that are yet to come? You guys are going to make it so darn hard for them that our program is going to cease to exist. And that's what you guys want. That is true. That is basically what they want. And Susana Martinez, she's another person, a good person of speaking. When she spoke about where her ancestors came from, she herself said her grandmother believed in traditional medicine. What is traditional medicine? From Mexico. Can't tell you much more than that, but.
Thank you.
Hi. My name is Jeremy Applin, and I operate Page Analytical, which to my understanding is still... thank you very much. So my name is Jeremy Applin, and I operate Page Analytical, which to my understanding is still the only state-approved testing facility in New Mexico. You know, when we look at these proposed regulations, I think all of us that are involved in the industry are aware of instances where people have conducted illegal, immoral, or unethical behavior. And as a regulatory agency, you are certainly tasked with the responsible oversight of this. But when we look at how to regulate an emerging industry, I think that you guys have failed. I've submitted a pretty extensive commentary on line by line for the testing requirements that you have proposed.
Yes, I've received that. Right.
Okay, great. So I'm happy that you've gotten a copy of that. But I think beyond that, we have to look at the state of our current market, you know, and the impact that regulations have on our market. When we look at the microbiological thresholds that have been proposed by the Department of Health, they're excessive and burdensome. When we look at those proposed regulations compared to other programs around the world, not just in the United States, my understanding is that Connecticut has proposed something similar, but they're not on the market. They're not operating. The only place that we see thresholds that stringent is in the Netherlands, and there are very specific reasons why they can achieve that. Now you compare that against New Mexico, which is a program that's been operating with, excuse me, little to no oversight since its inception. And now you guys come out with the more stringent rules on the books. What that does is it sets our industry up to have to retool or rebuild. These people, when they invested the money into their infrastructures or building out their grow operations, didn't anticipate meeting Title 21, or excuse me, United States Pharmacopeal Guideline 1111. Most of them don't even have any idea what the hell the USP is. I do. I come from a pharmaceutical background, and together with Len Goodman of New Mexican Natural Medicine and Tom Murray of SWAP, during the first 8 months of operation, what we did was we took Title 21 Code of Federal Regulations Part 111 and built a set of recommendations that were actually adopted by ASA and American Herbal Products Association, which a number of people have referenced today. What we did in New Mexico became the backbone for what's being touted around nationally now. And when we look at how this program is being led and what the leadership is doing from the regulatory side of it, it fails to acknowledge that. And that is insulting, demeaning, and selfish, and unresponsible. And ultimately, you are failing the patients of this fucking state. You need to wake up. We have to regulate because we have to protect these people, but it has to be done responsibly. And that responsibility is not present. Thank you.
Okay, we need David Otero, Christopher Castillo, and Aaron Kawaje.
Good afternoon.
Good afternoon.
My name is Pascual Maestas. I'm with Mountain Medicinal.
we will be applying for our licensed nonprofit producer license in the fall. I'd like to thank everybody for all your comments today. Very insightful. We're very excited to be submitting our application in the fall. We're looking forward to supplying patients in northern New Mexico, bringing money into our local economy, which is desperately in need, as well as take money away from the gangs that plague our small town. But I'm very, very dissatisfied with the proposed legislation. Under the current legislation, a first-year licensed nonprofit producer would pay a $6,000 fee. That's a $5,000 license fee with a $1,000 application fee. Under the proposed legislation, that goes up to $100,000. Let me say that again, from $6,000 to $100,000. That's a huge burden for us to overcome. This destroys competition, and it also encourages patients to seek alternative methods, including purchasing on the black market. Being so close to Colorado, I can tell you for a fact that the black market supply is not coming from Colorado. Colorado prices are much more expensive than current prices here, and it would just be impossible for anybody to purchase there and sell here. I can't tell you for certain where it's coming from, but I know it's funding organized crime in our town. On a side note, my fiancée, who was diagnosed with PTSD when she found her father dead, 12 years old after school, and who last year broke her pelvis in 3 places and her tailbone, has been unable to obtain a medical marijuana card due to red tape and the hesitancy of doctors in our area to sign off. I hope that the committee takes a stronger look at this proposed legislation and makes changes that will open up supply, make it easier for patients, and take away the money that is funding all the organized crime in our town. Thank you.
Buenos días, mi nombre es David Otero y vengo de Puerto Rico.
My name is Marie Casito and I'm with the Department of Health and I'll be helping this gentleman translate to the best of my ability.
Okay. Yo fui diagnosticado con una enfermedad en los riñones.
I was diagnosed with an illness in my kidneys.
Que fue tratado con quimioterapia y con prednisona.
I was treated with chemotherapy and prednisone.
Después de tener todos los efectos secundarios, como por ejemplo insomnio, pérdida de apetito, dolores en los huesos, cambio de personalidad, traté la marihuana ilegal.
He had many secondary effects, insomnia,
pain
in his bones,
cambios de personalidad.
Personality changes.
Yo no me toleraba yo mismo.
He just didn't feel like himself.
Cuando traté la marihuana, fui al bajo mundo a buscar mi droga.
When he started taking marijuana, he went to the to a drug dealer, to the black market.
Y pude recuperar mi sueño.
To be able to get his dreams back.
En Puerto Rico el programa no existe.
In Puerto Rico, these programs don't exist.
Ya yo perdí mi carrera como maestro y invertí también mi dinero de retiro.
He lost his career as a teacher and his retirement investments.
Finalmente pude tener acceso a mi Medical Cannabis Program card. Finally, I get my Medical Cannabis Program card. Yeah. Puedo ver muchos cambios en mí, física, mentalmente.
I can see a lot of changes in myself physically and mentally.
Pero si cambian las reglas viejas, realmente mi rehabilitación no puede ser adecuada.
If they change the regulations,
Mi rehabilitación no puede ser completada.
I can't complete my rehabilitation.
Yo sé que la marihuana, el medical cannabis, bajo su programa, tiene poderosos poder curativo.
I know that the medical cannabis program has a lot of curative possibilities.
Y aquí tengo que felicitar a los que están presentes para darse a escuchar. Aquí tengo que felicitar a los presentes.
I want to congratulate on those present
Porque nos podemos aquí escuchar.
because they can listen to us here.
En Puerto Rico, a mí me tratan como un criminal.
In Puerto Rico, they treated me like a criminal.
Aquí yo soy paciente, no soy banco.
Here, I'm a patient, I'm not a bank.
Las nuevas regulaciones no estoy de acuerdo porque actualmente también estoy desempleado.
I'm not in agreement with these regulations because I'm unemployed.
Si ustedes cambian las regulaciones, pues es muy peligroso no solamente para mí, sino para también esta gente.
If they change these regulations,
Va a ser muy peligroso no solamente para mí, sino también para los otros pacientes.
it's going to be very dangerous, not just for me, but for everyone, all the patients.
Quienes se atreven a utilizar el medical cannabis como tratamiento y como alternativa.
That need this program as an alternative.
Hay mucha quimioterapia y hay muchas drogas fuertes que los médicos sí recetan.
There's a lot of chemotherapy and other drugs that the doctors give prescriptions for.
Y no es fácil tener un sello de drogadicto. Es no fácil tener a sello como de un drogadicto, de un usuario de droga. It's not to be easy that you get a kind of sign that you are like a junkie. I feel like a professional. I'm a professional. I'm getting my family, but it's not here. I'm sacrificed by myself. In Puerto Rico, they told me like I'm stupid, but here I get my respect. Here I feel like a grape in the bunch of grapes. Not like in Puerto Rico, like I feel like a grape, but it's a bunch of bananas. Thank you.
Hi.
Hi.
My name is Christopher Castillo. Before voicing my concerns to the proposed changes, I would like to thank the Department of Health for assisting patients by empowering this program to allow this medication to treat chronic and incurable diseases that are not effectively treated with pharmaceutical drugs. However, I am concerned with the proposed changes. It will have a detrimental impact on the program and ultimately on the patients. I know that the intent is not to hurt those of us who are thriving because of this program. That's why I'm here, along with everybody else. The Lennon-Aaron Compassionate Use Act was basically a gateway to help people achieve the goal of better quality of life. The diagnoses that are covered under this act are not leaving these patients anytime soon. I would like to see this program succeed, not only for myself, but for the countless others that are assisted daily by the use of this program. As a patient, I'm concerned that I would need to look elsewhere other than legal ways to obtain a medication that has truly saved my life. If not for this program, I'd be drinking my way to death. Prior to this program, it's exactly what I was doing. Alcohol combined with prescribed medications would have eventually led to my demise, as it has for many, many others in the state. I'm a patient, not a criminal. I have respect for the state of New Mexico and the Department of Health. And I also have respect for their support of the personal production licenses. The added expense of annual federal background checks will be detrimental to the program, as well as the new rules to cut the personal plant count, which penalizes very sick patients that cannot afford to buy enough medicine to help fight their conditions. Due to my condition, since I cannot work, that is more expense that I can't afford. I'm almost done. I have post-traumatic stress, as well as 40% of all of the patients in this program. We would love to, why would we penalize patients for their disease and limit the one method that they have to treat it? The majority of drug overdoses are caused by prescription drugs found in medicine cabinets. The medical cannabis program fights to reduce prescription drug deaths, and cannabis use plays a major role in this type of reduction. I, as well as the stakeholders in the MCP, support a producer plant count increase. This would be imperative for the long-term success of the Compassionate Use Act. Therefore, this change is all that should be looked at. The punitive and misguided patient rule changes should be removed from the proposed recommendations. Instead, the Department of Health should meet with the patients to discuss and formulate these rule changes together, not implemented against them. Thank you.
Okay, after Aaron, we're going to have Brian Crum, Ray Mitchell, and Al Gunther. Thank you. Thank you.
Hi, my name is Aaron. I'm a patient of the program. I am diagnosed with PTSD. I just, when the survey was done last November and they came out saying what everybody that's part of the program knows, that there's a severe shortage of medication to everybody, I was really excited that the state was actually being somewhat proactive and taking into account that there was some issues that needed to be dealt with in the program. So I was really excited when that was done, and then when the results came back, and I read through pretty much the whole thing, and nowhere did I see in there that anybody in the program said, hey, we need to cut our personal production licenses in half, and also I think that the producers need to pay more money for their licenses. That common sense tells you those two things are going to cut our supply down. It's either going to make it more expensive, harder to access. Me, as I grow my own medicine, I'm not going to be able to produce enough for myself, so then I have to go buy some from the dispensaries, taking quality medication from somebody that's so sick that they can't grow their own. You know, I'm at least physically able to pick buckets of water up and water my plants and do those things. Somebody in a wheelchair dying of cancer or AIDS can't do that. So why in the hell are you going to, come after us? And it says in the question and answer thing that you gave us that it has to do with law enforcement having problems with people with PPLs. I'd really like to see some data on that. That's crazy. In addition to that, not one person has said one good thing about this. So I would hope that your recommendation would be that we start from scratch and start over and get input from the producers. The producers should be first at the table with the Department of Health, along with Jeremy from Page Analytical, because you have to develop something that's going to work. What this is going to kill everything that this program is. It's going to be done, and you're going to have more problems with people buying their medication on the black market. Crime rate's going to go up from that. So what is it that you're trying to accomplish here, other than upset a bunch of people? And that's another thing. You've known for how long that this meeting was going to take place. You knew that there was going to be more people than are in this that this room can hold. I know people that work in this building that got memos that said, hey, get to work early today because there's going to be a bunch of people. There's going to be a bunch of people in the parking lot. How did they know that? How did they know that? And you know that's going to happen, and you still let all these people that have serious problems severely upset outside. I was severely upset. I didn't experience combat. You know what I mean? Like, my problems are from other issues, but I guarantee you, I'm upset. I'm sure every veteran in here is really pissed off. Thank you, and thank you guys for listening.
Hi, my name is Brian Crum. I'm a psychiatric nurse practitioner. I'm probably managing somewhere closing up on 1,000 patients in the medical cannabis program at this point, mostly for PTSD. My friend, my attorney, John McCall here, was in the room actually probably an hour before I was. For some reason, his name was dropped off the list. So I'd like to share my time with him because we have some legal issues that need to be discussed at the meeting.
Thank you, Brian. I think that last set of comments was classic and critical. We got to remember the first thing is that the reason that we're here is because you are under a court order to increase the number of producers and the number of plants for the program. Two things, producers, plants. Why in the hell did you do all of this when the court told you to do that? Is this a political movida? And is what happened with the Open Meetings Act here today a political movida? Is this where the governor wants to focus her fight and her animosity in the next election campaign? Is this what she's going to do? Because I think it's really, really shameful that patients, medical patients, are the ones who are the victim of this battle that's going on that started in the courts. And all you had to do was come in and say, we're going to put 12 new producers in, we're going to put 150 new plants on, and this would not have happened. This would not have happened. All this anger, all this frustration, it wouldn't have been here. So we've researched and prepared a complaint under the Open Meetings Act. It follows Mark Brawley's 1998 complaint against the Police Oversight Commission. Mr. Brawley's sitting right over there, taking a picture of me at this time. And we've told you that there were concerns about what happened at the beginning of the meeting, which were classically explained by that last speaker. So I would ask that you get together with us, that we try to work something out here so that we can resolve this issue and go forward and split this up so that other details can be dealt with later, but the primary issue that the court said is the emergency that must be dealt with by September is taken care of. By September, we must take care of this.
And just to get a little closer to the microphone here, just a question for clarification. Chris, Susan, Ken, did any of you have any role in developing these proposed rules? Can you answer that even? Or are you not able to answer?
Well, I'm a hearing officer. I don't work for the Department of Health.
Okay. So I don't think that these are the people that we need to be upset with. My guess is they had nothing to do with these proposed rules. They probably can't name names about who did. I can name names. Maybe not for these particular rules, but this program has been under attack for at least the last year and a half. We started out with the medical board starting to go after medical providers who write referrals for this program. Stephen Rosenberg. Stephen Rosenberg, who is now one of our medical directors for the program, referred Dr. Nick Nardacci to the program, then turned him into the medical board, reported him as an impaired physician, testified against him at his hearing, and had him removed from his medical license. Nick Nardacci was the main person on the back of the alibi, along with Steve Rosenberg, who advertised to produce medical cannabis cards for patients. Can we talk about a little conflict of interest here? Not too long after this happened, and also we had Richard Rubin, who about the same time, he had his license pulled. He was a PA who dared to step on the toes of Steve Jankowski, who is the psychiatrist on the medical board.
What happened to their immunity, Brian?
It completely ignored. There's an immunity clause that protects these providers, but it's completely ignored by the medical board. They had their licenses pulled. Then we had these proposed, well, actually, first we had Dr. Olwelling. William Olwelling tried to remove PTSD as an indication for the program. That traumatized patients all over again. Then we had the medical board trying to impose rules without going through this type of a hearing process. They just wanted to do it across the board and change things themselves. That got shut down. They backed down. I mean, this is like all stuff that has been ongoing. Then we had, Steve Rosenberg got appointed as one of the medical directors, then Maureen Small was appointed as a medical director several months back. I had a patient, all of a sudden, referrals are getting denied. I've been doing this for years, referring patients into the program, and all of a sudden my referrals are getting denied. They don't even bother to contact me. They send things to the patient. The patient has to reschedule with me, come back in. They're dissolving trust between myself and my patients. Then I have to explain to the patient, okay, we got to figure out what's going on. We got it resolved. We got new paperwork sent up to the Department of Health. While we were waiting for this patient for the second time to actually be able to have access, he ended up overdosing on heroin and he died. So I lost a patient because of the inept quality of the people who are running this program. A few months after that, a few months after that, we have, a couple months back, one of my patients I found out had been murdered in a home invasion. There was no reason for his home to be broken into, apparently, but he had been very vocal about the benefit that he was getting from medical cannabis for treating his PTSD and had gone on some blogs mentioning the fact that he had a PPL and was growing his own cannabis. His family suspects that's the only reason that people would have broken into his house. He was trying to defend himself. He was murdered. It's these types of restrictions that we have in place on this program that artificially inflate the prices. It's because of these restrictions and these ridiculous requirements. The medical advice, the directors for this thing, they make up their own rules as they go along. Maureen Small, Dr. Rosenberg, Steve Rosenberg, they just make stuff up. And they are implementing those rules that the medical board tried to put in, and it has not gone through this rules-making process. And today is what is happening. It's just the next step in the attack against medical patients. They would rather see veterans putting bullets through their heads than getting the care they need. And it needs to stop. Thank you.
Thank you. My name is Ray Mitchell, and I'm here as an advocate for a very dear loved one, as well as every other patient that's suffering. First of all, I'd like to thank the panel, although I really don't understand why the secretary is not here himself. That shows a very big disrespect to the New Mexico's most ill people, as well as the veterans who have lost a lot of themselves, their physical being, as well as their quality of life. And I do call for his resignation as well. Her resignation, I don't know. Next, the changes. Why, like the man said before, put the more growers, put more product in the market. Don't do it on the backs of the small growers. They can't produce the same amount on half. That's like Exodus or somebody. The Pharaoh told the slave guys to make more hay make more bricks without hay. Don't be a Pharaoh, that's crazy. These people are sick, they're ill, they're hurting. I know my loved one is hurting right now. You had them standing out there forever. That's ridiculous. And then to have them come in here, a group at a time, this is poor representation. It's bad on your employees who had to suffer a stressful day. Don't run the government like this. This is not what we're in this state for. Don't change.
Okay, as for Mr. Gunther, we'll have Patrick Ruiz, Kurt Caballo, sorry about that, and Revolt Loring. Thank you. Thank you, sir.
Thank you. No, I think I'm going to fight this one through.
Okay.
First off, I'm retired military, 25 years. I am disabled, and I do vote. Now, as far as me voting goes, I'm beginning to wonder. Let me give you a little bit of background. I got here after doing a lot of research on medical cannabis programs. Being disabled, I can live anywhere in the United States of America that I choose. I served my country for 25 years, not because I was drafted. A lot of good men and women laid down their lives so I could be free. And I'm here to tell you right now, people, freedom is not free. Some of us gave more. I am fighting tooth to toenail every day with our great Veterans Administration, in which, you know, I think it's a farce also. After doing all the research, I came up with the conclusion that New Mexico had the best program in the United States of America. I sold my house in Texas. 1 week later, I was a resident of New Mexico. I have since then bought a property. I live here. I planned on being buried here. If by chance these rules go through the way you have them drafted, I will once again have to sell my property and move elsewhere. This is not fair. Ladies and gentlemen, let me say this. I'm just a little guy. Once upon a time, I made stupid money. I was a technician that not only did I not go to interviews, I interviewed companies. I interviewed companies to decide whether or not I wanted to work with them. I made crazy money. At this point, it's all about the money. Then it wasn't. Let me say this. In order for me to go to a dispensary and pay the prices that they're asking, I would be like on the opiates. And what a lot of people don't understand is everything you put into your mouth has to be processed through your body, either through your liver or your kidneys. My mother passed away on dialysis. My father is on dialysis right now. My brother was on dialysis. Dialysis is not the way to go. Say, for example, me growing. I lose a plant. That's a major problem. As some people in here already know, I'm not that good anyway. But if you lose 2 plants, it's critical. You can't do it. You can't cut back the number of plants the little guy has to work with. I can't afford to go to the dispensaries. I can't afford to go that way. I can't afford it. I'm on a fixed income now. I'm a disabled veteran. Give me a break. I've given to y'all. Can you give me a little consideration? Let's be fair. I don't think I'm asking that much. And then for me to have to relocate again, I don't know how I'd do it. I'd probably just end up going to the streets like everybody else. But thank you for your time.
Thank you.
Good afternoon. My name is Patrick Ruiz, and I'm a card holder. First, before I talk about the proposed regulations, I'd like to talk about injustice. That's a word that lawyers really know, at least you should know. The Department of Health had this meeting planned, as people have said, for a long time. They knew that this would only accommodate 240 people, yet you saw the crowd that was out there. So this was really a planned, really, they want to kill this program. They want to kill this program, okay? They knew about this for a long time. What about your microphone, ma'am? Your microphone, I mean, that's technology, right? I mean, even the president, all kinds of other people speak, and you speak in tandem, right? You speak, I speak, you speak, I. How in the heck can your microphone not work? How can they plan that? That's another thing. Oh yeah, and the third thing about the planning of this venue, it absolutely required that the streaming program work. Nobody could get on and watch the streaming program online. 500 people were supposed to be able to watch it. Not one did. Thank you! Now, let me get to the proposed regs. First, biometric identification. That's one of your proposed regs, that we are going to have biometric identification. Wikipedia definition says that it's used in computer science as a form of identification and access control. It is also used to identify individuals in groups that are under surveillance. I don't want to be surveyed. Now, the collection of biometric identifiers raises privacy concerns about the ultimate uses of this information. Now, lawyers, because I know you don't want the state to be sued because I think you represent the state, right? A far greater concern, say experts, is the protection of personal information in government databases. Consumer Reports found in a 2008 investigation that at least 44 million consumer records were lost or exposed by all levels of U.S. governments over a 3-year period. All levels of U.S. government. That includes your government level. Thank you for the reminder. On these bases, please do not use biometrics identification. Number 3, 7.34.3.11, registry identification cards. You start out with supplemental information required. A qualified patient or primary caregiver who possesses a registry identification card shall notify the department, ... And then it says, or change in status of the qualified patient's debilitating medical condition within 10 days, 10 calendar days of the change. Now you're striking this part. An extension shall be granted by the medical cannabis program or manager or program manager or designee upon the showing of good cause. In other words, somebody can get information in and they get 10 days, but now you're striking an extension for good cause? Why are you striking an extension for good cause? Just a question. Number 4, the department has 24-hour notice.
Mr. Ruiz, I'd ask that you start wrapping up,
Yes,
please.
ma'am, I will.
All right, thank
I
you.
will, thank you. The department has a 24-hour notice to give us if you're going to come to our home. But you know what's kind of interesting? No, it's if they have a reasonable...
Cops aren't even allowed.
Reasonable suspicion is the phrase, okay. So, what I'm saying is that the proposed regs already show that your suspicions are unreasonable. They don't even make, this doesn't even make sense. It doesn't even make sense. If you have a reasonable suspicion, shouldn't you call cops? Isn't it criminal? Yes, that's the answer to that question. All right, so, all right. I am, right now. You say that you're going to have a program that's in cooperation with law enforcement, 7.34.319. Okay, well, let me tell you what a big joke it is. On October 25th, 2013, I was in Phoenix for my father's funeral. My fiance, Chance, who was diagnosed with terminal ovarian cancer, was at home because she was on hospice. And while she was making great gains and improving from medical cannabis, oh, by the way, do you know how much medical cannabis it takes to help somebody who's got cancer? Do you know? I don't even see your heads moving. The answer is no, you don't know, because they're not in the proposed regs. It depends. Sometimes it could be up to 2 pounds. It depends on the person too. It depends on how much they can ingest. So you guys don't even know how much it takes. And you're trying to cut our count to half? You're waiting for a lawsuit to happen, baby. It's right. Let me just say this. So she couldn't go with me to my dad's funeral. I was gone for 3 days. She was improving. The tumors were shrinking, but she was fragile. Anyway, she called me in a panic while I was out there. Hi, honey. The police are here. They want to search the home. What do you mean they want to search the home? She goes, I don't know. I told them I was going to try to get a hold of you because you were the homeowner. And so they asked if they could search the yard. And I said, sure, go ahead. So they were searching the yard while we were on the phone. And then they came back and they said, we found cannabis plants. We want to search your home. So she went upstairs where I told her the cannabis cards were held in my top desk drawer. That's where our person producer license were. She went upstairs to get them. When she came back downstairs, there were cops in our house. She was at the bottom of the stairs. She didn't give them permission, neither did I. They were in our house, securing the perimeter. Securing perimeter means outside, doesn't it? Does anybody give me their time? Okay, there you go. They just said.
Mr. Ruiz, I need you to wrap up here, please.
The event, let me just say this. When the police were in our home, they treated my wife. We got married. My wife, Chance, was treated like a criminal. She's real tiny, but this big. One officer was saying, I think they should all go down. She heard that. When the police went into our grow room, they used flashlights, even though they knew that I told them the light would hurt the plants. They were also confused. They didn't know how many card holders were in the house. They didn't know how many plants could be in flower or vegetative stage. When they found no evidence of criminal activity, they left with their tails between their legs. There were like 6 or 8 of them there. So here's the deal. She had PTSD from that event. I could never get her back to homeostasis. She was my dream girl. I saw her in my dreams before I met her. Can you imagine going home to your wife or your husband and them not being there? Dying for something like this? She died for this cause. She died for this cause. She was beautiful, a spirit that everybody loved. She was kind, a wonderful person. The event was confusing and traumatic for me, but for Chance, who was in a debilitating condition, the event was horrific and nightmarish. I had to remove her from the house because she had PTSD. She had dreams a week before she passed away of me being taken from the house that we were then living in. On the 4th of January, we were married, and she passed away 9 days later. Now listen to this. This is a slap to me. I renewed my application in April, and I was telephoned by a woman named Andrea to say that I don't have a personal production license anymore. It was permanently revoked. Evidently, the cannabis program saw my wife on the news. And the only thought that administrators had at that news conference or that news report was that I was growing for people who didn't live in our house. And the DOH said that they sent me a certified letter that was returned for non-delivery. They called me and they said, you don't have a PPL anymore. I said, well, why didn't you call me before? They said that they sent this certified letter to my house. I said, why didn't you call me? Instead of sending me a letter, you're calling me now. I explained that I had to care for my wife for 3 months in another house. I explained what happened in our house. My home! Where I thought I was safe. Where I put my wife to protect her. I didn't receive no certified damn letter. You know what I was told? That's too bad. That's too bad. So here's my advice. Here's my advice. I'm a lawyer too, you see. Here's my advice. I won't charge you for it either. Be like the statue. Compassionate. Understand. All 3 of you are carrying cancer right now. All 3 of you are. We all are.
Everybody is.
We all have it. Look at the chemtrails that they're throwing on us. We haven't even talked about chemtrails. What are chemtrails? But this is the only thing. This cannabis is the only thing that's going to help us. Save us from ourselves. Thank you.
Thank you, Mr. Reed.
The other individuals to come forward will be Jamie Martinez, Doug Gordon, and John McCon.
Shalom. Baruch atah Adonai. Right? Hashem. Peace be with you all. All right? I want to believe that you're human beings and not cold-blooded reptilians. All right? It's not a joke. We're all sick people, and we are requesting that you take this knife out of our backs, because that's what these proposals are. These proposals need to go into the shredder, okay? And Governor Martinez needs to go back to her home state. Texas has good people, but the state of Texas would love to put all of us in prison for life. They're doing it right now with a young man who's charged with felony possession of pot brownies. He will be serving life in prison for pot brownies in the state of Texas. I do not want to live in a suburb of Texas. That's what our state is becoming. This is the great state of New Mexico. We all live here because it's the most beautiful place on the planet. Okay? And you're destroying it with these proposals. We're good people. We're not criminals. Let me tell you my story. I graduated from Santa Fe University of Art and Design when it was the College of Santa Fe in '99. I went to the film school. I'm an independent filmmaker. I'm working on a pro-cannabis movie that's going to be crowd-funded, that we're going to dispel all this ignorance. You're living in the 1950s with reefer madness. Anyone who supports these proposals is completely delusional, okay? I also have a graduate degree from the University of New Mexico in landscape architecture. I'm a sole proprietor of K2 Regenerative Design, and I believe in society, and I contribute to our country, okay? I use medical cannabis, and my health problems are none of your damn business. But let me share them with you. I'm a childhood sexual trauma survivor. I'm an abductee. I was abducted many times. And I want you to know that I've been through the mental health system, I've been on the pharmaceuticals, and they made me more ill than I came into the system. The mental health system is broken, it doesn't work. Medical cannabis does. The spirit plant was put here to heal us all, and you cannot regulate a naturally occurring plant species. We're going to use it legally or illegally. You choose. You need to concentrate on the meth problem and the heroin problem. That's what the problem is. Cannabis is not the problem. Thank you, and I'd like to invite all of you for a beer tonight or any time, and we can talk about this like rational adults. No one hates you here. We're just trying to get you to send the message to Governor Martinez that these proposals are ill-sighted. Thank you.
Thank you.
Hi, my name is
My name is Jaime Martinez, and I have cancer. I've been battling cancer for about 5 years now. I've gone through over 24 months of chemotherapy, 18 months of radiation, a stem cell transplant. Can you hear me now? All right. My name is Jaime. I have cancer. I have gone through over 24 months of chemotherapy, 18 months of radiation, a stem cell transplant, 6 intrusive surgeries, and currently I am about a year and a half post-stem cell. I owe it all to cannabis. I was one time at the peak of my therapy, I was taking 16 different medications in pill, liquid, and aerosol form. None of them helped. I was suffering side effects, constipation, pains beyond where the cancer was, bone pain, tenderness, inability to walk, nausea, sleepiness, lethargy, sweats. Decided to switch my therapy into cannabis edibles about 2 months after my stem cell transplant, and my cancer has disappeared. I had a tumor in my chest, roughly the size of a softball, between my heart and my lung. I was expected only to live for 3 months. But with cannabis infused into my chemotherapy and other treatments, I was able to overcome them and still be here alive today. These regulations on the producer prices are going to drive prices up. And currently, depending on which insurance you have, if you have insurance, poison is more accessible. If you don't have insurance, then any kind of help at all is completely inaccessible, and it's ridiculous. Thank you.
Thank you. Okay, can we have Mark Lowry, Leisha McBride, maybe? Sorry, I'm having a hard time reading that name. And Doug Gordon.
Good afternoon. My name is Mark Lowry. I'm certainly not a patient of the program, but I've been involved since its inception. And as an attorney, I've represented individuals with cards, producers, everybody within the system. And I just wanted to echo the comments from everybody that was made today, but, you know, just as an outside observer, you know, I think a couple of comments were made. This is supposed to be a compassionate program to help people with severe medical problems and disabilities. And it's just, I think out of all the comments that were made, I endorse them all. But I think one of the most mean-spirited aspects of these proposed regulations, and I truly mean that, mean-spirited, is that the people that are personal production for patients and caregivers, you've heard about the problems it takes for these individuals to grow medicine for their patients. And to make them destroy medicine that they successfully raise at the end of a season, it's just unfathomable to me that you would do that. And these regulations continue to endorse that proposition. They can't even share it with producers who could share it with other people. I mean, you have to destroy medicine. And I think, again, that's a classic hallmark that the proposed regulations and the regulations as they exist really aren't compassionate. They really don't take into consideration the needs of individuals with medical disabilities. And I would ask, I know that this hearing seems to be one-sided, but there are representatives for the program, and I know Mr. Rago just left. But what is the purpose of the testing, the increased fees? I mean, does anybody want to comment on that? I mean, everybody else has made comments, but can we hear from anybody that represents the program? I mean, these programs, these regulations have to be supported by something. And they're not supported by anything. Mr. Woodward, you want to make a comment to the patients, to the people that use the program? What justifies these onerous regulations? I thought not. But that's the problem. You know, it should be a compassionate program, not a mean-spirited one. That's all I have to say.
My name is Leslie McAaron. I'm with CG Corrigan in Albuquerque. I want to acknowledge what a complicated challenge it is to run a medical cannabis program. Indeed, Mark Kleiman, a UCLA professor, has also had a challenge implementing the laws in Washington. But we started 3 years before him, and we really are the gold standard in the USA. I don't think any international agency would dispute it. May it be the Dutch, may it be the Canadians, may it be the Israelis. And what I'm asking for is really to echo the sentiments of the doctors and to be evidence-based. You know, both evidence-based medicine and evidence-based policy. The prescribing in Israel for Israeli veterans is 6 ounces per week. I mean, those are veterans too, and that's in a state-run hospital. So I don't want decisions to be capricious or arbitrary. I really want them to be based in the literature in some regard. To that end, let me present one paper, the 2014 paper published in New Mexico. It's particularly interesting because it was published by the past president of the Psychiatric Medical Association of New Mexico, and he was the former clinical director of mental health services for the New Mexico Department of Corrections during the 1990s. So he has both seen corrections as well as a psychiatry practice. He has published a paper in 2014, which I'm happy to provide the citation to anyone, where he sees greater than 75% reduction in CAPS symptom scores on the first 80 patients he reviewed. So what I'm seeing is a 75% reduction in symptoms, and there is truly evidence to keep this program tight. And I trust that you all will do what is right and use evidence to make decisions. Thank you.
Thank you. Okay, after Gordon, we need Claudia Hoffman. Darren O'Neill. David O'Neill? Oh, David, okay. And Maria Beal, thank you. Thank you.
Hi, my name is Doug Gordon. I'm an Army infantry veteran. I own a Bobcat business and I'm also a realtor. And what has happened to me has messed me up in this town. I'm embarrassed to do business in this state now. I'm an Army infantry veteran who has served my country and been diagnosed with PTSD. Now I'm facing legal charges of negligent child abuse for my son that stole from me. Now Ken, the director of the program, has taken away my only legal protection I have for myself. Now let me tell you, I don't drink alcohol, I don't smoke cigarettes, and I do no other drugs. I'm a good citizen in the community, and cannabis is the only thing that helps me maintain my stability. Now, as the director of the program, you know I'm a veteran. You think that I'm up to something illegal, and you show up to my house unarmed, demanding your way into my home. What do you think, you're John Wayne, Dirty Harry? Who the hell do you think you are? Then I'm sorry, but this is my home, and I was scared for my safety. You're going to need to listen. Never at any point did Ken get told that he's not going to be able to see my grow. I have the entire encounter on 1080p high-definition video from the moment you walk up mumbling to yourself to the moment sitting at the end of my block. I got everything on video with audio. Now, I've been on the program for over 4 years. Never once has the Department of Health had any issues with me because I'm not doing anything wrong. Only a couple weeks after being embarrassed on the news, you show up with a concern. No, it's wrong what you're doing to me and I won't stand for it. I fought for my country. I don't know why you're turning on me. Tell me something. Why is it that MJ Espresso, one of the licensed current producers, was over their plant counting they still got a license? You didn't even see my garden and you want to take away my license? Must be coincidence you sent 4 letters just days later for the 4 exact license you came to inspect, big boy. No, I don't think so. Then you try to take someone's licenses and you didn't even get a chance to speak to them? It's a Friday morning at 10:10 in the morning. How many people are just sitting around? I'm sorry I had things I had to do. I'm sorry I was in the shower. I'm sorry you ain't got the balls to call me and give me an advance notice to let me know that you're going to come by. then you could have came by. Don't you just show up and tell me you're going to come in my house.
Mr.
or
Gordon,
you're
I
gonna call the
ask
cops
that
on
you
me. Call 'em on
maintain
me.
civility, please.
You ever show up in my house again like that, we're going to have problems. Big one.
Yeah, I got plenty of that too, right here.
My name is David O'Neill. I'm a patient, and I disagree with a lot of the regs, like a lot of people. One of the things that I disagree with is 60%. It seems an arbitrary limit on concentrates. And also, I've got spinal problems, my cervical and lumbar spine, and they progress to where in my cervical spine I get cervicogenic headaches now. The only thing that works for them, I hate to say this, is I've got to use Vicodin. Since I've been a patient, I've used a half of 5 milligram hydrocodone, and I haven't needed any more than that. It's been about a year now. But I can't titrate that. I can take a half one and drink as much. I drink a lot of coffee and I can roll the dice. I never know whether I'm going to fall asleep talking to someone or else I'm going to be able to walk around and do things in the house. With the concentrates, I can titrate it. When I have enough that I don't have pain, I stop. So adding a 60% arbitrary limit to it, my layman's knowledge of the processes are that you'd either have to stop the process or else adulterate the product, my medicine. So I don't think either of those is a good option. And the same thing with Cure Oil. I had diarrhea for a year after steroids and antibiotics after sinus surgery, and actually Cure Oil it treated and cured my stomach after a year, nothing else, and that really made me a believer. And that's another thing that would be that if you had a 60% limit, I think that you'd have to adulterate the Cure Oil, and I don't agree with that either. That's all.
All right, thank you.
Hi, my name's Maria Beal, and I am a legal cannabis card holder in the state. Let us grow, can't hold us back anymore. Let us grow, don't make it like it was before. I know that you're afraid of me, but I'm calm now, and I'm better. Let me be. I sent you guys this letter. Did you guys get it's got pictures in it and everything? I'm really concerned about and want to advocate for my right to grow my own and keep it at home. I want to ensure I have an adequate supply of cannabis, and I need a minimum of a 16 plant rotation to do so, and I'm adamant that unrooted clones should not be counted. The loss for a personal grower when you're starting clones is phenomenal. And from the 16 plants of my first grow, I took classes from the guys over here at Sandia. They were wonderful. Minerva has a grow shop that helps me learn and know what I need so I can raise my plants. But from my initial 16 plants, I got 2 to harvest, and I got less than a quarter of smokable cannabis, just so that you would know. New Mexico, one thing we grow in the desert is weeds. Okay, let us grow weeds that people are getting $10 to $30 a gram for. And let us fill our pockets with money, and get your money from the taxes, not at the front end of the operation, where you bind our hands and we can't accomplish anything. So again, let me say, I really want to grow my own and keep it at home. 20 plants would be a better number for me, because they're right. I am not a professional grower. The potency of the medicine that I can grow, how quickly my grow can get wiped out, is amazing. I am afraid. Let me tell you, I got a girlfriend that works for one of the casinos that carries fake urine in her breast, and she has a card in case she gets tested. So we need some protection when we're following your rules to not be retaliated against because someone else has a different idea and wants to use the big end of the government to come and get us. That would be wrong. So, okay, personal production needs to be considered separately from commercial production. We've already echoed time and time again not to reduce our number of plants. And I will leave the professional production people to make their own case. Please don't reduce the amount of plants that I can keep. Thank you.
Thank you.
Okay, Brenda Slevin. Keith Cedillo, I'm sorry about that name. I think that's what it is. James Pruitt. Are any of those folks here? Okay. Anthony Ortiz. Anthony Ortiz, he just requested to be added. Okay.
Hello, ladies and gentlemen. Thank you for your time today. I just had a brief discussion to talk to you guys about. It was a problem. My name is Anthony Ortiz. I own Repeal magazine. It's a medical cannabis publication that I put together to be the voice of the patients here in the state of New Mexico. I've had a little bit of fight on and off from both the Department of Health and publishers to get the right message across. But however, in the midst of that, I've become a huge resource for patients to come to and give their voice their problems to. I haven't put a magazine out for about 5 issues now that I should have already had out. It's very disappointing to me, but during that time, I've had a lot of calls from patients regarding occurrences that you guys do with your program. One of the ones that I just wanted to speak mostly to you guys about happens to be regarding your guys' angle and thoughts toward the plant counts that you guys are proposing. You guys did a secret, not a secret, but I guess a private calling to personal producers who had licensing, and you guys were asking them several questions regarding their personal production. And the calls that I got were upset patients not wanting to relinquish any information to anyone they didn't know was on the other end of their telephone. And I think that you guys, the department, got a bad feedback from it all. I mean, no one wanted to speak to someone on the phone that they weren't told was going to call them, asking them how many grams of cannabis they were going to be producing from their patient licenses, or when they were going to be cutting down. That kind of invades their privacy and kind of puts them in jeopardy to be releasing that information over the phone. If they would tell someone over the phone when they're going to be cutting down and how many grams, that's going to put them in jeopardy of getting a home invasion. Several problems you guys have been facing. So I did want to make you guys aware that Repeal magazine is here. We are a voice for the people, and I do have a lot of occurrences that I get phone calls about. I just don't really have no one to speak to about it because there's not much contact with producers, and there's also definitely no contact with the Department of Health between the patients. So I just thought I'd take the time to let you guys know that that survey you guys did was totally not even nothing. There was nothing. You guys got nothing out of that because no one you guys contacted was going to give you guys any type of private information that they were not notified prior to getting the phone call. Thank you guys.
Thank you.
Okay, Stephen Jaramillo, Logan Yetz, and Priscilla, I'm sorry, I can't read the last name. It looks like it begins with a G. Okay. Stephen Jaramillo, Logan Yetz, Priscilla. Okay, Jennifer Sanchez, sorry. Zeke Shorters, and Scott Ratzlaff.
I will speak. I just want to speak for part of the rules change. Part of it is that you guys want us to try the Western medicine. Like, if you don't try it, you won't even give us the option to do medical cannabis. I want to speak for those children out there. I was 13 when they put me on my first pharmaceutical drug that made me suicidal. I went to my doctor and told them that it made me suicidal. What he did was he upped my dosage from 5 to 10. Told my mother, it's not helping, Mom. She was no good to me. She forced those pills down my throat every morning instead of checking out my high school history teacher's butt. I thought of how I can steal my mom's car keys to take myself over a bridge to hit a train hard enough to explode myself, to make sure that I was no vegetable in a chair that I was absolutely dead. So, go back to the doctor. I ended up increasing my dosage from 10 to 15, then from 15 to 20, to where I went after work one night when I was 15, went to Walmart, bought 2 bottles of Tylenol, downed 100 pills at a time, fell asleep to wake up with my body convulsion. I could not walk. I could not even get to the living room. I army crawled to my mother to tell her I needed to go to the doctor. You know what she said? Go back to bed, bitch. Nothing's wrong with you. I went to her room, which I had an army crawl. We lived in a trailer, so I went from one end of the trailer all the way to the other end of the trailer, shaking like I am right now, but worse. Just to dial 911 to tell them that I OD'd, because at that time I did not want to die anymore. But now what you guys want is to force these pills and to go through these pill regimens that don't help, that alter your reality, that make you a zombie. I have a 4-year-old cousin who is on the same pills that I was on at 13. She's on them now, 4 years old. You should see her, lifeless. I just think you guys need to rethink it. You guys don't understand.
Thank you.
Forgive me, it's been a long day and I'm unable to medicate in public. My name is Scott Ratzlaff. I'm here today to ask you to not implement the proposed rule changes to our cannabis program. I'm an Army veteran living in Raton. Fighting in several wars, I came home diagnosed with PTSD and hit under my vest twice, one being spinal. After several surgeries, I was diagnosed with CRPS, RSD, a very debilitating disease, to say the least. Doctors tried in vain to free me from my prison of pain, giving me over 22 medicines. I have those down here, by the way. To help combat my RSD, PTSD, and associated illnesses. Needless to say, I took a pill to take a pill. I tried dorsal column stimulators. I tried morphine pumps. I even tried fentanyl patches up to 100 micrograms. Nothing helped. Nothing. It wasn't until my loving wife, being forced to see her once proud husband struggle with his own private nightmare, offered a suggestion. Try pot. I reluctantly tried it. Needless to say, it worked, freeing me of my burning, stabbing demon while allowing relief of my PTSD symptoms. That was 4 years ago. I've since learned that edibles, concentrates, or dabs, coupled with a cannabis oil regimen, works best for me. These proposed rule changes will devastate my access to safe cannabinoid medicine, on multiple fronts. I use RSO or Phoenix Tears, cannabis extract oil to be exact. These oils test at 80% or higher. This is a must for me. I've tried lower grades. It doesn't not only help, but it has a horrible half-life. I have to eat grams a day with this low-grade oil. It's not pleasant to tasting at all. While oil testing at 80% or higher does, however, seem to have a marvelous half-life and keeps my disease at bay. I also, as I mentioned, use dabs or concentrate for my pain flare-ups. Excuse me, I'm having a wrong. And tremors. These tremors and cramps associated with my disease are relentless, making my muscles spasm uncontrollably. In the past, this would have ended up with a trip to ER and hospital stay. I need to stop. When I would be pumped so full of opiates, they needed the Narcan on standby. Nothing, and I mean nothing, in the pharmaceutical world or cannabinoid medicine works better for me than concentrate or dabs for this immediate knockout pain. Nothing. Okay. In closing, I would like to briefly talk about the PPLs. I'm rural. I live in Raton. It's a drive for me everywhere to get medicine. Or one guy comes to see me once a month in a delivery, and he's taking a big risk every time he does that. We meet in a motel, at a motel. That's not very safe access to my medicine. If you cut my PPL, I make oil with those plants. I can't do that with 2 plants and survive. Thank you. I know you all do the right thing.
Thank you. David Otero Cordova and Simone Armijo. Oh yeah, I'm sorry. Sorry, I tried to do
I hear that a lot. I'm Zeke Shortis. I'm with Sacred Garden. We've been licensed, it'll be in July, 4 years, and we've been really proud to be here and to be able to provide good quality medicine to our patients. There's a couple of things I wanted to mention. One, on growing plants, I probably killed the first 700 clones I played with, and I had more plants to play with. If I had 4 bloom plants to play with, I've got my personal production license too, and because our plant count is so low, I use it as R&D for Sacred Garden to try and get the right strains that we need for our patients. It's 150 plant counts is ridiculous. Especially the cost per plant. Lyra from Fruit of the Earth was talking about the costs in other states. I broke it down by plant. I just went and checked out the Charlotte's Web guys grow in Colorado. They have 38,000 plants right now, and they pay $16,000 a year. That works out to 43 cents a plant. We pay $200 a plant, and we are the poorest or second poorest state in the country. That makes no sense. The $30,000 was significant already, and all the producers, we've just grinned and bared it because we were happy we had the opportunity to grow. But after looking at the other states, which this whole proposed rule change, ridiculous rule change has brought about, has made me realize that we are so out of line with anyone else in the country. Why would we do that to our patients? We're also one of the only states where our patients pay taxes on bud, on their medicine, not any other pharmaceutical. That doesn't make any sense to me. So, okay. Every time someone comes in, they pay an extra 8%, which doesn't need to be. It's their medicine. So, a lot of things going wrong. I think there's an opportunity to do the right thing right now for the administration, and I really want politics left out of my medicine. That's all.
Okay, David Otero Cordova and Simone Armijo, are they present? Oh, that's right. Okay, we already. Those are the only people I had signed up to speak today.
Can I just say one more thing?
Madam Hearing Officer, I just want you to know that the Linen Air and Compassionate Act is supposed to be about patients, and it's always been about law enforcement. Patients need to come first. They need to change their attitude. Thank you.
Thank you.
Hello, my name is Daniel Webster, and I'm not a criminal. Just thought I had to say that. Let's start out with the plant count. Obviously, the state feels there's an abusive process going on, and by cutting the numbers in half, we're going to reduce the amount of abuse. Is that part of the rationale? We don't know. Why 2 plants? Could we have just gone to 1 plant? Or how about 1 plant and an official state growing facility where you can keep a real close eye on us? It just doesn't make any sense. each step you're going is further and further into the rights of the patients. And the frustration and anger that's been exhibited today is there's a real sense that this is a done deal. This is all just window dressing. It's an end process. And is there any assurance that we can get that our comments will be incorporated into new regulations, which will then be presented again as part of the continuing process of feedback, renewal, feedback, and renewal to come up with a better process? Will there be other meetings?
I can't speak to that. I can tell you that as the hearing officer, I consider everyone's comments when I'm making the recommendations to the secretary.
Okay.
And what recommendations are you making?
About the rule changes, whether or not to adopt them, whether they need changes, and then I present that to the secretary.
In addition, there seems to be a lack of background justification being presented to the people. It's almost as if was a wish list that were being grabbed out of the air for what we want to do to change the regs without looking into any details or verifying that these are even possibilities, like the crazy heavy metals testing. I mean, you guys came up with oh my goodness, this would be a great thing to do without even researching, is this a possibility? How many other aspects of this regulation are equally fraught with, ooh, let's do this? Is there any background? Is there reference? Is there research that you can use to support your propositions so that we feel, that's where that noise comes from, so we feel that we're not being ignored, that there's a rational process here. It's a black box machine right now, and you guys make a decision, this is what we're going to do, and we do it. That is a real strong sense right now that it is a done deal. And my only suggestion would be that there would be another step involved where another iteration would be allowed, where now we've massaged the regulations, we maybe didn't go far enough some places, maybe we need to go a little farther somewhere, and then re-present it for review. That's the only thing that I would suggest, please.
All right, thank you, Mr. Webster.
Bye-bye.
And I just wanted to conclude, I spoke with Brian Crum earlier, but you've heard everything you need to hear. This is real simple. You could save us millions of dollars because there are 5 lawsuits going on right now. There are a bunch of lawyers that have been in the room, and there could be more litigation. Or you could just adopt what the court has asked by September. And instead of increasing the plant count by 150, increase it by 500. And the U.S. House of Representatives, of course, just voted to defund DEA raids on medical cannabis states and to recommend that the DEA reschedule cannabis to Schedule 2. That's important to note in this proceeding that the first paragraph of that House bill says reschedule cannabis. You could save our state hundreds and hundreds of thousands of dollars if you would do the 500 plants and the 12 new producers. I could almost guarantee you, knowing most of the potential litigants in the room, that there would be no lawsuits if you would simply make those 2 changes and put all the rest of this down the road for some other proceeding some other time. Make it simple. You have the opportunity to save the state thousands and thousands of dollars. I'm sure that would make any politician happy in this election season. Thank you.
Thank you.
Hi, my name is Alfonso Garcia. I am an employee for one of the producers, but I'm here as a patient. DOH last year paid for a survey to be done to find out that there was a shortage. And it had been over 3 years that shortage had been going on. Within 6 months, they not only found out that there was a shortage, but added, I'm not sure the exact number of new regulation changes that were not thought out in any way. There's something wrong with each one of those regulations. I'm going to the page where questions and answers, and they say that there's problem with a diversion on law enforcement side. Well, according to the survey, I have numbers here of there's 1,737 patients that have PPLs that grow a total of 188,414 grams per year. That's 108 grams a year and 9.3 grams a month. Also, according to the survey, the average weekly amount of medicine being purchased from producers is 10 grams a week. If that is the case, the personal production growers are not even growing enough medicine for themselves. So I don't see where they're coming out with diversion when they can't even grow for themselves. Also, another problem is that the cost to obtain a patient's card. Another $50 fee on top of, well, we're talking about the PPLs now, a background check, that's another cost. I don't know, I heard $30. I don't know, but the cost there also is involved. Another really big problem that I have is them eliminating section 7.34.4.2, which is assessment report that the DOH should have done within 2 years. As far as I know, I've never heard an assessment was ever done, and now wanting to eliminate that section of the law, who's going to watch out for us patients? There is another question on compassion. Where is it with these rule changes for the patients in the program? That's it.
Thank you, Mr. Garcia.
My name is Jim Ritchie, and well, I'm a patient. It was for chronic pain, and before I couldn't walk. I was bedridden in opiates, right? And somebody said try cannabis. Well, I did. So now I finished college. I have a job, right? And I'm a productive member of society. But what the problem is, right? You can't get patients, right? Because people are afraid of their job, right? Some people have debilitating pain. They take opiates, they still work, right? They're dazed at work, everything. But if you take marijuana, you want to help people, help them keep their jobs, right? Right? Don't say, okay, we're not going to protect your job, right? Because of this. That, pretty much all I got to say is that if you get more patients, if you say, okay, protect your jobs, you decide to use cannabis as your medicine. Right? Not at work, but being able to be productive. Because opiates just, you can't work on them.
Thank you very much.
My name is John Crawford.
I don't think the microphone is on, sir. I couldn't hear you.
I must have made. My name is John Crawford. I'm a patient. And although I hate the expenses going up, I'll pay whatever I have to pay because it has made a tremendous difference in my life. 2 years ago, I was sick unto the point of death and sick of it unto the point of death. The only reason why I hadn't built and sat in my suicide chair was I'm as stubborn as they get. And I hung around because I didn't want to dump certain problems in other people's laps. Fortunately, I quit listening to my doctors. I am a victim of industrial medicine. And now I'm no longer type 2 diabetic. I'm much lighter. I'm no longer high blood pressure. I have my permanent debilitating condition of degenerative cervical disc disease and degenerative thoracic disc disease. I'm beginning to get good enough health to look forward to their cutting my throat. That's how they treat the cervical. I won't go into the thoracic. I'm probably not going to treat it. But there are some basic issues of law that need to be addressed. One, the title of the Compassionate Care Act defines its intent, and the courts will take that into consideration. Two, denial of right under authority of law is a criminal act both federally and state. These things reflect on the manner in which the department administrates the program, and the fact that deprivation of right under authority of law states the person, puts the criminal and civil liabilities on the individuals who are providing the services. Now, I would like to say thank you to the legislators that passed the act and to the governor that signed the act. The revisionist approach that's being taken is clearly not compassionate care. The department should fulfill its responsibilities to provide compassionate care. The situation with the producers, since there is continually a shortage of product for patients, yes, they need to be able to have more plants. And the more plants you allow them do not increase the administrative costs significantly at all. So there is no justification for increasing the charges for that reason. That would also reduce the price of the product to the customers who are medical patients needing medical care. And the deprivation of right under law also applies to such things as the Patients' Rights Act. Those are rights granted by law, including the right to have adequate medication and appropriate treatment for their conditions. So I charge you, be compassionate, obey the law, do your job the way it should be done, not in a repressive and probably criminal fashion. Thank you.
Thank you, Mr. Crawford.
Hello, I'm Jim Pruitt. I was diagnosed 5.5 years ago with multiple sclerosis. After that, I started taking tons of drugs to deal with the various symptoms, everything from constant headaches to muscle spasms to depression, all sorts of things. 4 years ago, I enrolled in the medical cannabis program, and since then, I have cut the number of drugs significantly down. I am no longer using any opiates to help with the pain, which is wonderful, and now I can actually go poop. What I'm most opposed to in these restrictions is the personal production limit going down to 2 plants, whereas before I was taking a cocktail of pharmaceuticals, now I'm taking various different types of cannabis to help me manage various different aspects of the condition that plague me daily. So this kind of cannabis will help with my headaches. That kind will help with my muscle spasms. This type will help me sleep. This type will help with my depression. So if you limit me to 2 plants, then I've got to pick. Do I want to go to sleep, or do I want to, not have muscle spasms? So that's really all I have to say. Thank you.
Thank you very much.
We're asking if possible. We're asking the government body to have a human heart.
This is all good information. Appreciate you covering it.
Is that,
I would like to say thank you for you guys showing up here.
thank you, I appreciate that.
I know you had to deal with a lot of us, me particularly with my anger. That's a lot of my issue with this medical stuff. I've got an attorney that's suing for medical malpractice because of what they did. The medical doctors are totally out of line with what's going on with patients that know what's going on with themselves. I was in here last year, and this lady here, she saw me breaking down because I thought I wasn't going to make it last year. And honestly, I wound up in the hospital after my 4th diverticulitis attack. I couldn't eat. I lost 55 pounds. In June, when I went to the emergency room and the hospital didn't do anything, I called 911 to get me a doctor in there because nobody would do anything at the hospital. I wound up finally getting a foot of colon taken out in October on the 4th. 9 days later, I had a heart attack. I went home. I had another heart attack with a completely blocked artery, the main artery going out of my heart. I've got 60% blocked on my, what do you call it, widowmaker one. This isn't a game. This autoimmune thing has destroyed my thyroid. These psycho doctors tell me it's in my head. I've got the medical proof. I've got testing, medical tests that can prove and show the difference between me being on the medical cannabis and not being on it, and what it's doing to me. I can show you numbers. None of these damn doctors want to even hear me about it. My background is diesel mechanics. I'm very good at troubleshooting and diagnosing. When I came here, I worked for one of the biggest attorneys in the state because I do copies and stuff. I did law documents. For 10 years, I put together law documents. That's why I know what I've put together here. That attorney's office also was the ones that took care of Presbyterians' lawsuits. If you saw those lawsuits of the medical malpractice and the crap that goes on, you would never go back to the hospital yourself again. I went up there and I had to fight to get a doctor to remove a foot of colon out of me. I died 3 times last year. I didn't think I was going to make it in June because of this incompetence in these doctors. I went to endocrinologist specialist. You want to, that 0.081 on my TSH 6 weeks later was over 100, maxed out on the chart. You know what that endocrinologist told me? It's in my head, go see a psycho. I just left the psycho doctors after almost dying, laying on the ground having an anxiety attack, and the fire chief in Belen left me laying there. The cop in Belen, one of the 2 cops, sat there and said there was nothing wrong with me, and I got charged with disorderly conduct. You think this is a joke? I've been through hell down there.
No, I don't think it's a joke.
And you think that I'm sitting here, I'm fighting for my life, trying to figure out my medical aspect, and I got these fucking cops down there harassing the hell out of me. In fact, one of the state cops, well, there's about 3 of them that's going to get sued. The state is going to get sued for what they did. This is.
You need to finish up, okay? I know you got.
I know. It's just.
I know.
This whole medical thing is way out of hand.
I do guarantee we're taking this seriously, though. Okay?
I hope so.
We are.
Definitely
because there's too many people that are dying because of your decisions and the governor's decisions. She knows about this crap down there too. Ask her about it. She knows who I am. Ask the new chief of police here for the state. They know who I am. Those cops aren't even allowed in my house.
All right. All right,
You're
sir.
violating my civil rights. And it happened out here this morning. You violated my civil rights, all of our civil rights. As well as, I'm suing the state for, or the city of Belen because of the fact of the violating my civil rights, telling me I can't go into a public building. I didn't do a damn thing, and they were the ones threatening me and harassing me.
Right. Well, I want...
Enough of this corruption. That's what this is. It is corruption.
Thank you. Oh, I guess I should formally close the hearing. I want to thank everyone for attending, although most people have left already today, but thank you very much. I greatly appreciated hearing from every single one of you, so thank you very much. And I will enter the department's exhibits into evidence. I also have the public comments that I've already received that I will enter into evidence, and then folks have until July 1st to submit additional comments. Thank you very much.